Hello guys. So now we shall be discussing the important topics in pelvis. Okay. So regarding the pelvis, first of all we'll make out few differences between the male and female pelvis. Okay. Now when it comes to the male pelvis, if you look at the bones of the male pelvis, see this is a difference between a male pelvis as well as a female pelvis over here. So female pelvis is a bit broader and wider, okay, in compared to the male pelvis. Okay. So that is the reason why you can accommodate the babies over here. Okay. So next important thing is that coming to the male pelvis over here. So if you look at the bones, right? So the bones of the male pelvis are bigger. The bones of the male pelvis are bigger, right? They are thicker and they are heavier. They are bigger, thicker as well as heavier. Now when it comes to the female pelvis, it is completely opposite. So if it is bigger over here, it is smaller. Here thicker, here it will be thinner, and heavier it would be lighter over here, lighter. Okay. Next, when you look at the sacrum bone, right? So if you look at the sacrum bone is longer as well as narrow. So if you look at the sacrum bone in case of males, it is longer as well as narrow, whereas the sacrum bone in the females, it is shorter and wider. Okay. If you look at the sacrum bone over here, it is longer, right, and narrower, longer and narrower. It is shorter and wider. It is shorter and wider over here. Okay. Next, when it comes to the pelvic cavity over here is very narrow. Okay, the pelvic cavity is narrow and it is deeper. Pelvic cavity is narrow and deeper, whereas the pelvic cavity here would be wider, okay, and shallow. Wider and shallow. If you look at the pelvic inlet, there are two important things. One is called pelvic inlet and one is called as the outlet. So this entry point, whatever is there, this is called as the inlet. This point, whichever is there, this is called as your outlet. So one is your pelvic inlet, another one is your pelvic outlet over here. Now if you look at the pelvic inlet in case of males, the pelvic inlet is heart shaped. It is heart shaped, whereas the pelvic inlet in females is oval shaped. Okay, so that is oval shaped. So this is a pelvic inlet over here. So if you can see, the pelvic inlet is oval shaped over here. The pelvic inlet is heart shaped over here. So somewhat it is heart shaped over here. Okay. Right. When it comes to the pelvic outlet, right? So the pelvic outlet is small. There is small pelvic outlet. Small pelvic outlet. When it comes to the pelvic outlet here, obviously, as the baby's head has to pass out as you're giving birth, so the pelvic outlet has to be broader, right? So here you would have a broader, the large pelvic outlet. The large pelvic outlet. When it comes to obturator foramen over here is small and here the foramen is large. If you look at the obturator foramen over here is round and here it is triangular. When it comes to the suprapubic angle, it is less than 90 degrees, which is smaller. Obviously here it will be more than 90 degrees. Okay. So these are the key differences between the male pelvis and the female pelvis, which you have to know. So now we shall be discussing regarding the sacral plexus. Our topic of discussion would be regarding the sacral plexus. If you look at the sacral plexus, so from where the sacral plexus is usually formed, sacral plexus is formed by anterior or ventral divisions of L4 to S4. Okay, so it is formed by anterior or ventral division of L4, spinal segment L4 all the way to S4. Okay, so how do we draw this sacral? Instead of drawing this sacral plexus directly, I'll go with the root values. Okay, so first what we'll do is that we'll write it as L4, L5, then S1. Okay, now what you have to do is that you have to start numbering the next three from the middle L5. So how do you number? So it will be L5, after that what will be there? S1 and S2. L5, next we have got S1 and next we have got S2. Okay, again you have to start numbering from S1 over here. So we have got S1 and we have got S2. There is no S3 here. Okay, so again you have to start from here, that is S2. The next three numbers S2, S3, S4, S2, S3 and S4. So previously what did we do? Previously we have selected the last two numbers S1 and S2. Now we'll select the first two numbers S2 and S3. So I'm writing here as S2 as well as S3. These are all the spinal segments. And finally what you do, you write down all the segments over here. So we'll write S4. Next, L4. Then we have got what? Then we have got L5. Then we have got S1, S2 and S3. So these are the segments over here. Okay. So if you look at the sacral plexus over here, so let us see from each segment what nerve is coming out. For example, L4, L5, S1. Okay, from here there are two important nerves that come. One is called as superior gluteal nerve. Superior gluteal nerve. Okay, now another important nerve is, I'll tell this nerve later on, but look at L5, S1 and S2, the nerves which are coming out of this, one is superior, so now it will be inferior. Inferior gluteal nerve, inferior gluteal nerve. Okay, inferior gluteal nerve. Here also another branch is coming. What is this branch? See, along with superior gluteal nerve, you will have nerve to quadratus femoris. Nerve to quadratus femoris. In the same way, here you will have nerve to what? Obturator internus. Obturator internus. Nerve to obturator internus. Okay, nerve to obturator internus. Next, S1 and S2. From S1 and S2, you have nerve, right? So what is the nerve over here? You have nerve to piriformis. Nerve to piriformis. Okay. When it comes to S2, S3 and S4, you have a nerve called as pudendal nerve. You have a nerve called as pudendal nerve. Next, from S2 and S3, you have the posterior cutaneous nerve of the thigh. These things you just have to remember, okay? Posterior cutaneous nerve of your thigh. And finally, we have got a sciatic nerve. We have got a sciatic nerve over here. Okay. Now, important thing you need to know is that this particular superior gluteal muscles, whatever are there. So if you look here, this particular superior gluteal nerve, okay, superior gluteal nerve, whatever is there, this will supply to your trio muscles. What muscles it is going to supply? To your trio muscles. What are your trio muscles? There are three trio muscles, three muscles together called as trio muscles. One is called as gluteus medius. Okay, one is called as gluteus minimus. Another one is called as tensor fascia lata. Tensor fascia lata. So gluteus medius, gluteus minimus and tensor fascia lata, three of them together you call it as a trio muscles. Okay. Now coming to nerve to quadratus femoris. Nerve to quadratus femoris will supply which muscle? One muscle here already it is there. What is that muscle? That is your quadratus femoris. Okay. Now coming to the second muscle, I will tell you in a minute. But before that, coming to the inferior gluteal nerve. Inferior gluteal nerve will supply what? See, superior gluteal nerve was innervating your trio muscles. Trio muscles is having gluteus medius minimus. What is a muscle that is, what is a gluteal muscle that is missing over here? Maximus. So gluteus maximus is supplied by your, gluteus maximus is innervated by your inferior gluteal nerve. Okay. Along with that, already there is a nerve named obturatus internus. So it is supplying your obturatus internus along with the second one. What is the second one? Within the lower limb, we have got two important muscles. These are called twin muscles. Twin muscles. What are those twin muscles? Are gemelli. One is called superior gemelli, another one is called inferior gemelli. So here we have got superior gemellus. Here we have got inferior gemellus. Superior gemellus and inferior gemellus. Next we have got a nerve to piriformis. The name itself, it supplies to your piriformis muscle. Okay. Now coming to the pudendal nerve. Pudendal nerve gives the basic supply to 5 important structures. What are those 5 important structures? 2 of them are sphincters. One is called as external anal sphincter. External anal sphincter. Okay, another one is called as external urethral sphincter. Okay, after that you have got 1, 2 and 3 important sphincters. These you can remember by BIL. What does B stand for? B stand for bulbospongiosus muscle, which is present in the penis. Bulbospongiosus muscle. I stands for ischiocavernous muscle. Okay, ischiocavernous muscle over here. Ischiocavernous muscle. And L stands for levator ani muscles. So levator ani is not a single muscle. There are 3 muscles within that. Levator ani muscles. Okay, levator ani muscles. Okay, so it is giving supply to all of these 3. And sciatic nerve, you know, it supplies your entire posterior compartment, right? And posterior cutaneous nerve of the thigh, it supplies to the skin, posterior in the sense back. Cutaneous supply to the thigh. On the back of the thigh, the cutaneous supply is given by S2, S3 segments of sacral plexus. So this is all you need to know regarding the sacral plexus. So now we shall be discussing regarding the pudendal nerve. Pudendal nerve. So from the previous explanation over here, pudendal nerve, what is the root value of pudendal nerve? It is S2, S3 and S4. So all the way from S2, S3 as well as S4, the nerve which is emerging out is your pudendal nerve. Okay. Now this particular pudendal nerve, this is your pudendal nerve, right? This is your pudendal nerve. So what will happen? What is the course of this pudendal nerve is that here you have got 2 important openings. What are those 2 important openings? See, here you have got a foramen. This foramen is called greater sciatic foramen. In the same way, down here you have got another foramen which is smaller. This is called lesser sciatic foramen. So what are these 2 foramens? This is called as greater sciatic foramen. Here you have got lesser sciatic foramen, greater and lesser sciatic foramen. Okay. Now between this greater and lesser sciatic foramen, here you have got a ligament. This is called as sacrospinous ligament. Okay. You know, we have got the ischial spine, right? Ischial spine. So all the way from the sacrum to the ischial spine, you have got a ligament called sacrospinous ligament. So this ligament over here is your sacrospinous ligament over here. Okay. Now after this, here down you have got another important canal. You see this canal over here. What is this canal? This canal is called as pudendal canal. What is this? This is called as your pudendal canal. Okay. So what is the course of this nerve? So first this particular pudendal nerve, it passes through the greater sciatic foramen. Okay. So this particular pudendal nerve, basically it passes, this greater sciatic nerve, it passes through the greater sciatic foramen. After that it passes behind the sacrospinous ligament. Then it passes through the lesser sciatic foramen. Okay, it passes through the lesser sciatic foramen. Then it travels all the way through this canal. What is this canal? This canal is called as your pudendal canal. So this is called as your pudendal canal. Pudendal canal. So this nerve comes out of this pudendal canal, and the moment it comes out of the pudendal canal, this particular nerve is going to give a branch. Okay, so what is this particular branch by name? The name of this branch is inferior rectal nerve. This branch is inferior rectal nerve. This is a branch. What is this inferior rectal nerve is going to do? This will innervate your external anal sphincter. See, it is innervating your what? External anal sphincter. So it would give a motor branch to external anal sphincter. Okay, it is giving a motor branch to external anal sphincter. Along with that, this is also giving a sensory branch. It is also giving, this inferior rectal nerve is also giving the sensory branch to what? Your anal skin. anal skin. It is also giving a sensory branch all the way to your anal skin. Okay. Now, after that, this particular pudendal nerve will give two important branches like this. What are these two important branches? One is called as a dorsal nerve. Okay, so this one over here is called as your dorsal nerve. And what is the name of this nerve? This is called as your perineal nerve. Perineal nerve. So dorsal nerve, perineal nerve, inferior rectal nerve. These are the three most important branches. So what does this dorsal nerve do is that dorsal nerve gives sensory branches to penis in males and clitoris in the females. Clitoris in the females. Whereas this perineal nerve, what does this perineal nerve do? This perineal nerve gives the motor innervation to four important muscles. So how do you remember these four important muscles? You can remember by the mnemonic bile, B-I-L-E, bile. Okay, so what is B stands for? Bulbospongiosis. Bulbospongiosis. Bulbospongiosis muscle. I here stands for ischiocavernosus muscle. Ischiocavernosus muscle. Ischiocavernosus muscle. L stands for levator ani muscle. Levator ani muscle. And E stands for external urethral sphincter. External urethral sphincter. UE stands for external urethral sphincter. Okay. Now, along with that, it should also give a sensory supply. Yes or no? So, it also gives sensory supply to two important branches over here. I mean, two important structures over here. One is labia majora. Labia majora, right? Another one is labia minora. Labia majora and labia minora. So this is in case of females, right? And it also gives supply to scrotum in males and urethra. Scrotum and urethra. This is the sensory supply. Okay. So these are the branches over here. So this is all. And by the way, what are the important things you have to keep in your mind? That it gives main three branches: inferior rectal nerve, perineal nerve, and dorsal nerve. Okay. And these branches, whatever are there, all of these branches are your sensory branches. What are these? These are all your sensory branches. Next, coming on to what are these branches over here? All these branches over here are your motor branches here. So these branches are motor branches. Okay. So I hope we already discussed this motor branches previously. See, external urethral sphincter. Next, bile, B-I-L-E. E stands for external urethral sphincter, bulbospongiosus, ischiocavernosus, and levator ani muscles. Okay. So if you look at the muscles over here, there are some of the muscles which you can see. So if you look at the muscles over here, I told you levator ani. Within the levator ani, there are three important muscles I told you, right? So what are the three important muscles? Just focus on this muscle. So from where it is starting? See, this is your pubic bone, right? This is your pubic bone. And this muscle is not attaching on the back. Is it attaching to the coccyx? No, it is not attaching to the coccyx. What is this muscle actually doing? See, this is the muscle actually. Let us say posteriorly. See, where sacrum is, that is the posterior side, right? Posteriorly, what do you have? You have got rectum. See, let us say this is the pubic bone. From the side, if you are saying, this is the pubic bone. Okay. So posteriorly, what do you have? Posteriorly, you have got the sacral vertebra like this. So let us say these are your sacrum like this. Okay. Next, between the sacrum and this one, you have got this particular structure. What is this? This is called as your rectum. What is this? This is your rectum. Now, this muscle is originating all the way from your pubic bone. So, it originates all the way from the pubic bone like this, and it completely loops this rectum and again comes and attaches to the pubic bone. Clear? If this is a rectum, this muscle is going like this, looping around the rectum or hooking around the rectum, and it is coming and attaching to the pubic bone back. So that is why you call this muscle as puborectalis. What is this muscle? Puborectalis. So here you see there is a loop. Can you see a loop over here? So within this loop, what is the thing that is fitting here? This is your rectum. That is why this muscle is called as puborectalis. puborectalis. So puborectalis is one muscle of the levator ani. Okay. After puborectalis over here, look at this particular muscle down. So again, this muscle is also attached from the pubis, right? But all the way it is attached to the coccyx. So what do you have to call it as? Pubococcygeus. So this is called as pubococcygeus muscle. Now what is this muscle over here? You see what are these spines over here which you can't see on the other side in this weave? This is called ischial spine, right? So all the way this muscle is attached all the way from the ilium, right? Ilium, all the way it is going and attaching to your coccyx, right? So you call it as iliococcygeus muscle. This is called as iliococcygeus muscle. So these are the three important muscles of levator ani. These are the three important muscles of your levator ani. So now we shall be discussing regarding the topic of pelvic floor. Okay. So our topic of discussion would be regarding the pelvic floor. So if you look at the pelvic floor, so actually this pelvic floor is a funnel shaped structure. It is a funnel shaped structure. Okay. Now if you look at this entirely is your pelvic floor, which is a diamond shaped also, right? So if you look at this pelvic floor is between, you see there is sacrum behind and pubic symphysis in between, right? So there is sacrum behind and here you have got the pubic symphysis. So between the sacrum and between the pubic symphysis, whatever muscles you have got here, all these they form the pelvic floor. Now within this pelvic floor there are two openings. You see there is one large opening, there is one small opening. So this opening is present near the pubis, right? That is why you called as urogenital opening. And this opening is present near the posterior side, back side you have got the rectum. That is why you called as the rectal opening or rectal hiatus. Okay. So what are the important things here? This particular pelvic floor is having two openings. This pelvic floor is having two openings. So what are those two openings over here? Yes. What are those two openings over here? One is called as urogenital hiatus, another one is called as a rectal hiatus. First of all, let us write down what are the different functions of this pelvic floor. What are the important functions of this pelvic floor? First important thing is that with the help of, see, down we have got the pelvic floor, right? Down we have got the pelvic. Now I can't show my pelvic floor to you. So down you have got the pelvic floor, you need to understand, right? So this pelvic floor which is located down is having two openings. See, one opening on the front, one opening down here. So this opening which is on the front is called as a urogenital and back side is called as a rectal opening. Okay. What are these muscles that are forming the pelvic floor doing? See, what up here you have got the abdomen. Down is the pelvic floor. So in the abdomen, whatever organs are there, all these organs are supported by the help of this pelvic floor. If this pelvic floor muscles are very weak, what will happen? These organs will prolapse into the rectum. Have you heard sometimes the rectum is getting prolapsed outside? Rectal prolapse, right? Uterine prolapse. So all these prolapses will happen. Next important thing is that first important thing is it is supporting all your abdominopelvic viscera, all the organs which are located in the pelvic cavity, in the sense your uterus, vagina, right, your let us say the fallopian tubes, the ovaries. So all such structures are supported within this, and abdomino in the sense the structures located in the abdomen. So all these structures are just supported with the help of this pelvic floor. Second important thing is that, for example, whenever you are coughing, what will happen? There is increase in the abdominal pressure. Because of this increased pressure, don't you think the organs are pushed down? So when the organs are pushed down, do you think your intestines are coming out of your anus? No. Why? Because of even there is increased abdominal pressure, these pelvic floor muscles, right, they will provide resistance. Okay. And next important thing is that, see, whenever you want to defecate, you will defecate. Whenever you want to urinate, you will urinate. So automatically is urination and defecation happening? Now I am sitting here, am I defecating or urinating? No. Why? Because even if I feel a sensation of defecation or urination, my pelvic floor muscles will contract to close those openings. So it means that if my pelvic floor muscles are not working properly, then there will be what? Urinary incontinence, and there will be fecal incontinence. Without even your own will, you are defecating, you are urinating, right? So there is leakage and there is defecation. So that is what happens. So first of all, let us write down the three important functions. So the first function is that it supports what? The abdominopelvic viscera. Abdominopelvic viscera. It supports the abdominopelvic viscera. Second important thing it does is that this will provide a resistance to what? This would provide resistance to what? Resistance to increased abdominal pressure. Resistance to increased abdominal pressure. Third important thing is that it would also help in providing resistance to urinary and fecal incontinence. Okay, how it is providing? Because in the pelvic floor itself we have got sphincters. In the pelvic floor itself, what do we have got? We have got sphincters. So by contracting the sphincters, it means by sphincter action on what? Posteriorly, what opening you have got? Rectal hiatus. Sphincter action on rectum. Anteriorly, what is aperture you have got? Urogenital hiatus. So sphincter action on urethra. In the urethra also, external, we have got the urethral sphincters, anal sphincters, external anal sphincters and all. With the help of these internal, external anal sphincters, we are able to hold our waste materials. Okay, hold our products of what? The fecal matter. Okay, so these are the three important functions over here. So what are the main muscles that are forming the pelvic floor? We will discuss about pelvic floor detailedly, but what are the main important components? So within the muscles of pelvic floor, there are three important muscles. So you call them as components. There are three important components. What are those three important components? Is that the first important component is levator ani muscles. We discussed already. Levator ani muscles. We will discuss about that in detail now. Levator ani muscles. Second important thing is coccygeus muscle. And third important thing is the fascia that is covering these muscles. The fascia covering these muscles. Fascia covering these muscles. Okay. Now coming to the levator ani muscles. How many levator ani muscles we have got? We have got three levator ani muscles. Okay. What are those three levator ani muscles? From the pubic bone, which is completely surrounding the rectum. What was that? Puborectalis. We discussed it, right? I have also shown you. Puborectalis. From the pubis to the coccyx on the back, that is called as pubococcygeus. Pubococcygeus muscle. Okay, and next we have got iliococcygeus muscle. Three muscles: puborectalis, pubococcygeus and iliococcygeus muscle. So we will discuss about these muscles in detail now. The first muscle over here, what is this? This is your buttocks, right? This is the posterior side. Now what is this? This is your pubic symphysis. This part over here is your rectum. And you see this muscle is particularly hooking up this particular rectum over here, right? So what is this muscle doing? So this is the main muscle for maintaining fecal continence. For example, let us say, think that this muscle is not there. If this muscle is not there, do you think the rectum will be the same shape like this? No. So how will be the rectum? So let me draw this. This is a rectum now. It is contracted like this at the lower part. For example, why it is contracted at the lower part? The reason being that here we have got a muscle in this way. Okay, the reason being here we have got a muscle in this way. So that is the reason why the rectum is contracted in this way. For example, if there is no muscle, then what will happen? What will happen is that this is how the rectum is. Now when this is of the rectum is, for example, if I'm coughing, see in first case, if I'm coughing or sneezing, in these activities what is happening, there is increased intra-abdominal pressure. Because of this increased intra-abdominal pressure, whatever fecal matter you have got, this fecal matter is pumped down suddenly. But instead of, even if it is pumping down, one of the pelvic floor muscle, that is your puborectalis, what it is doing, it is not letting this fecal matter to go out. Sometimes you might also have noticed patients in the ward, right? So when they are sleeping, suddenly if they cough, or suddenly if you press their abdomen, because of increased intra-abdominal pressure, they will pass the gas suddenly. So the flatulence, right? So this, why it is the same thing. So here, for example, if this muscle is not present, in some of the patients the pelvic floor muscles are weak. So when the pelvic floor muscles are weak, what will happen? Because of sneezing or coughing, so suddenly your pelvic floor muscles are weak, right? And you been to a party and suddenly you sneezed or cough, whatever it is. So what will happen? Whatever food material is there, that will exit out. Okay, so there is no continence over here. Yes or no? So this is called as fecal incontinence. Okay, so the main muscle for fecal maintaining the fecal continence is puborectalis. So puborectalis. What is a puborectalis over here? This is the main muscle for fecal continence, for maintaining fecal continence, okay. So for maintaining fecal continence, this is mainly seen in case of, for example, in case of coughing or in case of sneezing, okay. So from where does it originate? Origin is from pubic symphysis, and it forms a U-shaped sling around the anal canal. So it is forming a U-shaped sling around the anal canal. So one muscle we are done, one component we are done. What is that? That is your puborectalis. Now after puborectalis, look at this muscle all the way from the pubis to the coccygeus. What is this? This is your pubococcygeus muscle over here. Okay, so what does this pubococcygeus muscle do? What does it do is that mainly the abdominal and pelvic organs, whatever are there, it gives the support and stability for these organs. Okay, so basically it is responsible for the stability and support of abdominal and pelvic organs. Stability and support of the abdominal as well as pelvic organs. Next important thing, we have got this muscle over here which I told you, that is your iliococcygeus. Okay, this muscle is your iliococcygeus. So from where it is originating? It is originating from this spine. You see, this is called as ischial spine. It is originating from your ischial spine. Not only ischial spine, this will even originate from, repeat. So it is originating from the ischial spine, and where it will attach, that is important. It is going and attaching to the coccyx. And also remember this thing, it will also attach to a tissue called perineal body. It is a fibromuscular tissue. It will also attach it to a tissue that is called as perineal body. We will discuss about this perineal body. Okay, perineal body. Next important thing, what does it do? What does it do is that this muscle mainly elevates the pelvic floor and anorectal canal. Okay, what does this muscle do? Whatever pelvic floor is there, it will elevate the pelvic floor like this. Okay, so this muscle will elevate the pelvic floor and anorectal canal. So this is your iliococcygeus muscle. And final muscle which you have over here is your coccygeus muscle. So from the name itself, it is clear that it is going and attaching to coccyx. But from where? From the ischial spine. from the ischial spine all the way this muscle goes and attaches to sacrum and coccyx. Okay, sacrum and coccyx. So this is your coccygeus muscle. Now what we'll do is that we shall write down all these muscles now, and we shall look at what nerve is supplying each and every muscle. Okay, so nerve supply in pudendal nerve I've already discussed, if you remember, right? So we have got levator ani. Within this levator ani we have got three important muscles. One is called as puborectalis, one is called as pubococcygeus, one is called as iliococcygeus. So puborectalis is innervated by what? See, all these three muscles are innervated by nerve to levator ani, and another one is your pudendal nerve, This thing we have discussed before itself. Okay, and finally we have got this coccygeus. Coccygeus is innervated by what? It is innervated by the anterior rami of what? S4 and S5. Okay, so if there is paralysis if there is palsy, right, if there is nerve injury to all these nerves, then what will happen? Then what is going to happen if the nerves are not working? If there is injury of these nerves, then these muscles won't work, right? So if these muscles don't work, then what is going to happen? Then obviously moi, right? What is this moi? So when you sneeze, when you cough, you are ready to defecate wherever you want. Okay, so this is what happens with the patient here. So now we shall be discussing regarding one of the very important concept of perineum. So we shall draw the pictures over here and discuss what is this perineum and all. So first of all, before we discuss the perineum, you have to know where is the location of the perineum. So perineum is down, right, just above your pelvic outlet, okay, and below your pelvic diaphragm. So where is that location? We will discuss now. So first important thing is we will discuss about the location of perineum. If you look at the location of perineum over here, so I am drawing a coronal section. Okay, so in that particular section, so this is your pelvic bone over here. Okay, and this is your pubic symphysis. Okay, yeah, so this is a coronal section with the pubic symphysis over here, and here you should know that there is a tuberosity, ischial tuberosity. Yeah, there is a tuberosity over here. Now all of you should know that this entire part over here is called as a pelvis. Okay, now in this pelvis there are few important parts. Okay, for example, let us say I am drawing an imaginary line between the two pubic rami over here. Okay, so this imaginary line, whatever I am drawing over here, this is your pelvic inlet. This is the entry point of the pelvis. Okay, this is your pelvic inlet. And next, down over here you have got another important, let us say another important the imaginary line which I have drawn over here. So this is called as your pelvic outlet. So one we have got is the pelvic inlet, another one we have got is the pelvic outlet. Now between the pelvic inlet and the outlet, here we have got a structure over here. This is called as diaphragm. So what is this diaphragm over here? This diaphragm over here is called as the pelvic diaphragm. What is this? Pelvic diaphragm. So this is called as a pelvic diaphragm. Above the pelvic diaphragm, this particular area, whatever I am highlighting right now, is what is called as a true pelvis. Okay, above the pelvic diaphragm, this particular area is called as your true pelvis. This is called as your true pelvis. Okay, and where is perineum? This lower part is called as your perineum. This lower part over here is called as perineum. Now you understood where is the location of perineum. It is located below the pelvic diaphragm and an imaginary line called as pelvic outlet, above the pelvic outlet over here. Now, so there are two important things we will discuss. There are two important borders we will discuss. One is called anatomical borders, one is called surface borders. First we will draw the male and female genital region, right, the male and female perineum, and here we will discuss the surface borders. Later we'll dissect deep into the bones, and there with the help of the bones and the muscles that are attaching over there we will discuss the anatomical borders. So first, when it comes to the surface borders over here, let us say this is the anus over here in males, right? So this is his left thigh, this is the right thigh over here, right? And all of you know that here there is testis, here there is testis, and up here we have got the urethra like this, urethra with a glans penis over here, and not to forget that this is the pubic region. This is the pubic region over here, right? Now what I'm doing is that I'm going to draw a dotted line over here. So this is the dotted line. So this dotted line is diamond shaped. Okay, so this covers your anus posteriorly like this. So this particular structure, whatever I highlighted over here, right? So this entire structure, right? So this is what is called as your, this is what is called as your perineum. Okay, so what are the borders of perineum here? Yes, what are the borders of perineum? These borders of perineum which we will discuss here are called as surface borders. Okay, these borders over here are called as surface borders. Now when it comes to the surface borders, anteriorly what do you have? Yes, anteriorly what do you have? So this border over here is called as your anterior border. Okay, so anteriorly you have got the base of the penis. So this is the base of the penis here. Okay, so anteriorly I have got the base of the penis over here. Okay, next, what is the posterior thing I have got? See, this is your right gluteal region, left gluteal region, and this gap, whatever, this cleft, whatever you can see, is called as a intergluteal cleft. What is this? Intergluteal cleft. Okay, so anteriorly we have got the base of the penis, posteriorly we have got the intergluteal cleft, and laterally what do we have? We have got the medial surface. And laterally what do we have? We have got the medial surface of the thighs. Okay, so this is the medial surface of your thigh. So laterally we have got the medial surface. Here also we have got the medial surface of the thigh. Okay, so let us write down the things. Anteriorly what do you have? Anteriorly you have got the base of the penis, base of the penis. Okay, next, posteriorly what do you have? Laterally what do you have? Posteriorly I have got the intergluteal cleft. Okay, so the superior end of intergluteal cleft, superior end of intergluteal cleft, superior end of intergluteal cleft. Next, laterally we have got the, what do we have? The medial surface of the thigh, the medial surface of the thigh. Can I also tell the medial surface of the thigh as the inner thighs, the inner surface of the thigh, right? So that is the inner surface of the thigh over here. Now let us draw the female perineum, right? And by the way, see, this diamond shaped area is called as perineum, right? So now let us draw the female genital region, and there we will describe what is the perineum over here. Now let us draw the female genital side and discuss where is the perineum over here. So here we have got the anus, right? And this is the thigh over here, right? Next important thing is that let us say that this point over here is called as your clitoris. Okay, just beneath this you have got an opening called as urethral orifice. Okay, and just beneath here you have got another opening over here is called as vaginal orifice. Okay, and all of them are surrounded like this. And remember one thing, this structure which I'm drawing over here is called labia minora. After that this particular structure which I'm drawing over here is called as labia majora. Okay, so here you have got, what is this? This is called as your labia majora, right? So this particular one over here is called as labia majora, and the inner one over here, this one is called as your labia minora. So you have got the major pudendal lips and the minor pudendal lips. And obviously let me finish up the picture by drawing the remaining part of the thigh. remaining part of the thigh, and not to forget that this region is the pubic region over here. This is the pubic region over here. So this is in case of females, right? Now, where is the perineum here? That is a very important thing. Where is the perineum over here? So perineum starts all the way from the top. Okay. So this entire thing down, you see, this entire thing is called as a perineum. Okay. So first of all, let us label these things and then we shall draw the things here. So this is called as your labia majora. This is called as your labia majora, right? And this is your urethral orifice. Urethral orifice. This is your vaginal orifice. Vaginal orifice, and here we have got the anus. Right, and remember thing, this is called as your mons pubis. What is this? This is the mons pubis over here. Okay, so this part over here is called as a mons pubis. Now let us make the surface markings over here, surface borders. So surface borders are again, we have to write down what is the anterior border, what is the posterior border, what is the lateral border. Now tell me what will be the anterior border over here. So this is the anterior border. Anterior border is having what? It is having the mons pubis. Posterior border, again the same. Posterior border is having what? Posterior border is having the intergluteal cleft, the superior end of the intergluteal cleft. Next, lateral border, what it is having? The medial surface of the thighs. Okay, so coming to the anterior border, we have got the mons pubis. So mons pubis in females and the base of the penis in males. So here posteriorly we have got the superior end of intergluteal region. Superior end of intergluteal region, and laterally we have got the medial surface of the thighs. Medial surface of the thighs over here, right? Now after this, what we shall do is that we shall discuss about the anatomical borders. So this, in this picture you can very clearly understand about the anatomical borders. So in this particular picture you can very clearly understand the anatomical borders. So here if you see this entire thing, okay, see this entire thing over here is called as perineum. Diamond shaped structure is called as perineum. You see, perineum is divided into two important triangles. This is called as an upper triangle. This is called as a lower triangle. Clear? Upper triangle and lower triangle. We will go into those details later on. But for now, what we will do is that we shall write down what is the anterior border. We have got anterior border. I am discussing about what? I am discussing about the anatomical borders, not the surface now. Anatomical borders. So in this anatomical borders, this is the line which I wanted to represent over here. Okay, now anteriorly what do you have? So we will discuss anterior, we will discuss what is the posterior border, we will discuss what is the lateral border, and additionally too, that is what is the roof and what is the base. Roof, opposite roof is base. What is the base? Okay, now coming to the anterior border. Anteriorly what do you have? Where is the anterior border? This is your anterior border. This is your posterior border. Okay, you see anteriorly you have got the pubic bone here. Both the pubic bones joining together at this point. What is this joint? Pubic symphysis. Anteriorly I have got pubic symphysis. Anteriorly I have got what? Pubic symphysis. Posteriorly what do I have? Posteriorly I have got what? This is the coccyx. Posteriorly I have got the coccyx. So posteriorly you have got the tip of coccyx. Posteriorly you have got the tip of coccyx. Laterally what do you have? Now laterally just look here. Just look here. What is this particular bone over here? This particular bone over here is your pubic bone. Now in this pubic bone, if you are looking from below, this will be the superior rami. Right, so you know the pubic bone here, if this is a pubic bone over here, pubic bone with an obturator foramen and a pubic symphysis in between. So if you look here, this is called superior ramus, this is called middle ramus, this is called inferior ramus. Now you are looking from beneath. If you are looking from beneath, what is this particular structure over here? Yes, this is called as your inferior ramus, which means this particular line which I'm drawing over here is your inferior rami. So laterally we have got the first thing, that is inferior pubic rami. Inferior pubic rami. Along with this inferior pubic rami, what do I have? I even have these tuberosities. You see these elevated regions called as tuberosities. What tuberosities are there? These are called as ischial tuberosities. Okay, so I also have ischial tuberosity. Ischial tuberosities. Okay, and third important thing which is not shown here is that, see, let me, yeah, it's black. Yeah, so look here, what is the third important thing is that all the way from the sacrum, this is your sacrum, all the way from the sacrum to this tuberosity, ischial tuberosity, you have got a ligament like this. You see, it is not given here. This is a ligament. What is this ligament? Ligament is connecting the sacrum from this tuberosity to this tuberosity. So you call sacrotuberous ligament. What is this ligament? Sacrotuberous ligament. Sacrotuberous ligament. So we have got three important things: inferior pubic rami, ischial tuberosity, and sacrotuberous ligament. They form the lateral border. Now roof. What is a roof formed by? Just remember it. Roof is formed, we will discuss it. I'll show you the pictures. Roof is formed by the pelvic floor. Roof is formed by the pelvic floor. And base. What is a base formed by? Base is formed by the skin and fascia. Skin and the fascia. So whatever borders I have discussed right now are called as what? Anatomical borders. So here we done discussing about the surface borders as well as the anatomical borders. Now what we will discuss? We will discuss what are the other structures. I mean, we discussed two borders, anatomical surface borders. Now we will discuss some more deep borders. Okay, deep to this, there are some ligaments that are present. Okay, so what are these ligaments? What are these tuberosities? And also deep to that, what are the structures we have got? We will discuss. So these are called as a deep boundaries or deep borders. Okay, deep borders. We will discuss some deep borders. So this image will be repeated again and again. Okay, so just look at the deep borders here. I'm just very roughly drawing the pubic bone. So let us say this is your pubic bone. Okay, and all of you know that here we have got your obturator foramen like this. Clear? And yeah, so this is your pubic bone. I'm not drawing the complete pubic bone. So this is the pubic bone which you are looking from below. And by the way, on the back side over here, you have got what? What is this thing on the back side over here? This is your coccyx. What is this? This is your coccyx. And what are these two structures over here? This is called as your ischial tuberosity. Ischial tuberosity, which means this one. You see, this ischial tuberosity. Okay, and yeah, now look here. Now another important thing which you need to understand, and yeah, by the way, this is your pubic symphysis over here. Now just beneath the pubic symphysis, you actually have got a ligament here. You see, this ligament is located beneath the pubic symphysis. So can I call it as inferior pubic ligament? Or tell me, what is the shape of this ligament? Isn't it looking like an arc shape? So can I call it as arcuate ligament, right? So this ligament over here is your inferior pubic ligament or arcuate ligament over here. Okay, next important thing is that on the sides here you have got a tendon. This is called as conjoint tendon. Repeat. On the sides, next important thing is that what are these structures which I am drawing on the sides? This is called as your conjoint isio-pubic ramus. What is this? Conjoint of isio-pubic ramus. Conjoint of your ischium as well as pubis. Isio-pubic ramus. The connection, right? Next important thing, from the tuberosity to the sacrum, the ligament over here, what did I tell you? What was this particular ligament which you have over here? Yeah, what is this particular ligament which you have over here? See, this particular ligament over here is called, this particular ligament over here is called as what? What is this called as? This is called as your sacrotuberous ligament. So this ligament over here is called as your sacrotuberous ligament. Now overall you can see this entire cavity over here. So this is what is called as your perineum. Now if I ask you, and by the way, what is this? This is your tip of the coccyx. Tip of coccyx. This is your tip of coccyx. Now if you look at the deep boundaries, in the deep boundaries, what is the anterior border? What is the posterior border? Now what is the anterolateral border we will discuss. What is the lateral border we will discuss, and we will also discuss what is a posterolateral border. Okay, anterior border in the sense this is anterior border. See, this is your anterior border. Posterior border, what is posterior border? This is your posterior border. Anterolateral, these are two anterolateral. Posterolateral, these are two posterolateral borders, and lateral borders, these are the lateral borders. Okay, once again, this is anterior border, this is posterior border, these are lateral borders. Now next you have got anterolateral, posterolateral. Okay, now it will be easy for you to tell each and everything over here. So first, coming to the anterior border, what is anterior border made up of? See, anterior border is having the inferior margin of your pubic symphysis. So this inferior margin of pubic symphysis is having an arcuate ligament over here. Okay, so anterior border is nothing but your inferior margin of what? Inferior margin of your pubic symphysis, or you call it as arcuate pubic ligament. Arcuate pubic ligament. Next, posterior border is consisting of what? It is consisting of tip of the coccyx. Posteriorly you have got the tip of coccyx. Tip of coccyx is present. Anterolaterally, what do you have? Anterolaterally here we have got conjoint ischiopubic ramus. Conjoint of this ischiopubic ramus. We have got the conjoint. Ischiopubic ramus over here. Laterally, what do we have? Just look here. Laterally, what do you have? Laterally here you have got, what are these two structures? Ischial tuberosity. Laterally you have got the ischial tuberosity. Right, and posterolaterally what do you have? Sacrotuberous ligament. Posterolaterally you have got sacrotuberous ligament. This is a structure you have got posterolaterally over here. Okay, now what we do is that we shall put up the same picture and we shall draw some more important structures that are attached to this. So what we will do is that we shall just rub these things out, right, copy paste this picture. Right, so we are right now putting up the same picture over here. Yeah, look at this picture. So let me duplicate it, because we will divide it for both the males as well as the females. Both for the males as well as the females, right? Now, tell me what are the structures that are located over here one by one. What are the structures which we have got over here one by one? Now, first important thing I want to do is that I wanted to draw a line touching the two ischial tuberosities. You see, I am drawing a horizontal line, a dotted line touching the two ischial tuberosities. Now, at the center of this line, we have got a fibromuscular body, a fibromuscular tissue. This fibromuscular tissue is called perineal body. So, this structure is called as perineal body. Okay, next important thing is that anteriorly you have got an opening here. This is called urethra. In males I am discussing right now. Posteriorly also you have got an opening like this, right? This is called as anal canal. What is this? Anal canal. Now this anal canal, onto the side of this anal canal you have got a muscle called as external anal sphincter. Okay, what is this structure over here? This is called as anal sphincter. That is your external anal sphincter over here. Next, on the sides of this anal canal, you see a space here as well as here. You see, on the sides of the anal canal, you see a space. This particular space is called as isio-anal fossa, or you can call it as isio-rectal fossa. What is this space called as? This is called as isio-anal fossa or isio-rectal fossa. You call this as isio-anal fossa or isio-rectal fossa. Now here very clearly you can see two important triangles. Yes or no? You can see actually two important triangles. See, this triangle which is present anteriorly over here, this triangle over here is called as an anterior triangle. Next, this particular triangle which is present on the back posteriorly over here, this triangle is called as posterior triangle. Okay, so how many triangles we have got? Anterior and posterior triangle. In the anterior triangle, what do you have? What is this structure called as? Urethra. So this triangle, this anterior triangle is also called as urogenital triangle. Urogenital triangle. Anterior triangle is called urogenital triangle. In the same way, this posterior triangle, whatever is there, where the anus is present, so you call it as anal triangle. You call it as anal triangle. You call it as anal triangle. What are the muscles that are forming these triangles and all? I will discuss it later on. But for now, just know this important thing. What are the contents that are located in the anal triangle, guys? Yes, what are the contents we have got? One content we have got is this opening. This opening is called anal aperture. Anal aperture. Next, what is the second opening? Surrounding this anal aperture, the muscle which you, the sphincter which you have is external anal sphincter. External anal sphincter. Third important thing, on either sides you have got isio-rectal fossa or isio-anal fossa. How many you have got? Isio-anal fossa, you have got 2. And fourth important thing which you cannot see, let me put it here this way. I am drawing a small dot over here. This is called as your pudendal nerve. So posteriorly you have got pudendal nerve also. Pudendal nerve over here. So these are the structures that are located over here in the anal triangle. Okay. Now when it comes to the female, again the same. In the female also, let us say, touching the two, connecting the two ischial tuberosities, I am drawing a line over here. This is called as your in the center of this line you have got a body. This is called as your perineal body. Anteriorly, what do you have? The same structures as you have in the males. You have got urethra. Yes, you have got the urethra. Just behind that, what do you have got? You have got this orifice. What is this orifice? Vaginal orifice. This is your vaginal orifice. And posteriorly, what do you have got? You have got anus. Anus with a sphincter over here. External anal sphincter. And next, again, the isio-rectal fossa is again the same. It is not changed. Isio-rectal fossa or isio-anal fossa is the same. It is not changed. Now, if I ask you what are the contents that are located in the anterior triangle or urogenital triangle in case of females, you know what to say. And in case of the posterior triangle also, you know what to tell here, right? Now, what we will do is that here within this, this is from the base. You are looking from below, right? For example, if a person is standing like this, right? If you are looking from below, this is how it looks, right? This is how it looks. Now what I am doing is that instead of looking from below, you are making a coronal section. I mean, you are cutting the body like this so that it is dividing into anterior and posterior half. Right? Then from the front, if you see the structures, how does the structures look? That is very, very important. Why? Because now I am going to discuss about within this perineum, there are some pouches that are formed. Okay. So what are the pouches that are formed? In case of males, we have got two important pouches in the perineum. One is called superficial pouch, deep pouch. Okay. We will discuss about this superficial as well as deep pouch here. In case of males, in case of females. Okay. Now we will discuss about the perineal pouches. Perineal pouches, very, very important topic, guys. So what we shall do is that we shall draw the cut section in this way. Okay, not the transverse section, not the transverse section, not the sagittal section. We will do the coronal section. In the coronal section, right, if this is my body, you are doing a coronal section, right? My body will divide into two halves like this. This is a front half, this is a back half, okay, anterior and posterior. Now I remove the front half. Now whatever you can see here is the section which I am drawing right now. So in this coronal section, we will discuss what are the superficial pouch, what is the let us say the deep pouch, superficial perineal pouch, deep perineal pouch, right? In males and in females also the superficial and the deep. And what contents are located within the superficial perineal pouch in males and females, and in female and deep perineal pouch in case of males and females. So 4 important things we are going to discuss now. Very major topic over here. Okay. Now, first what we will do is that in the males, we shall start on with the urinary bladder. All of you know that this is your urinary bladder. Okay. Now continuing down to the urinary bladder over here, you have got this particular structure. This is called urethra. Okay. Now let me draw another important thing over here. So this is the bulb region. Okay, and remember one thing, that there are two important openings. I mean, there are two important ducts that are opening into this. Okay, you see these ducts are guarded by these two important glands. So what are these two glands? These two glands over here are called as bulbourethral glands. Okay, what are these called? Bulbourethral glands of Cowper. Okay, or Cowper gland. Clear? Bulbourethral glands or Cowper gland. So what is this? This is the urethra actually, which is located in the bulb of the penis. I will tell you all these things now. Okay. Next important thing is that on both the sides we even have to draw the ischial bones. Next important thing is that on both the sides here you have got the cut sections of the pubic bone. Okay, on both the sides over here you have got the cut sections of your pubic bone like this. So these are the cut sections of your pubic bone. Okay, now after these cut sections of the pubic bone, next very important thing you have got here is that first let us draw the deep perineal pouch over here. Okay, so this picture which I am drawing right now, okay, this particular picture which I am drawing right now is your deep perineal pouch. Right. So what is this entire white color layer that is located between these two blue lines over here? This is called as your deep perineal pouch. So let me highlight it. See, this entire thing over here is your deep perineal pouch. And again, the most important thing is not practicing the picture. You should first identify what image is this, right? Which section is this? That is very important. I hope you understood. This is the coronal section, right? Coronal section. Okay, you have got urinary bladder in the center, and you see these two pubic bones usually used to be like this, right? Now what did we do? We have cut down the hands. It means the pubic bones are cut. So only this part you will be able to see. So these are the two parts over here. Clear? Right. Next important thing is that attached to this you have got two important muscles. Okay, attached to this you have got two important muscles. So here you have got a muscle like this. This muscle over here is called as your obturator internus muscle. What is this muscle? This muscle over here you call it as the obturator internus muscle. Okay, so this muscle is obturator internus muscle. Next, in the medial part of this, medial to this obturator internus muscle, we have got two more important muscles here. What are these two more important muscles? You see, these are called as levator ani muscles. Now, how many levator ani muscles do you have over here, guys? Yes, how many levator ani muscles you usually have? You have got two levator, each levator ani muscle. Each levator ani muscle is having how many parts? There are three parts. If you remember, we have discussed the three important parts. We even discussed, looked at the pictures also, right? So these muscles over here are your levator ani muscles. Okay, and not to forget that here you have got your, what is this? This is called as your prostate. So this is your prostate. So the urethra that is attached to the prostate is prostatic urethra. We will discuss about these things later. And by the way, what was this gland called as? This gland over here was called as your bulbo. Yes, what is this? This is called as bulbourethral gland of Cowper or Cowper's gland. You usually call it as Cowper's gland over here. Now this pouch which I have drawn over here, this pouch, a band of pouch, you see this pouch which I have drawn over here is called as perineal pouch. Which perineal pouch? This is called deep perineal pouch. Now this particular deep perineal pouch is having two important fascia. What are the two fascia? One on the top is called superior fascia, one on the bottom is called as inferior fascia. Okay, let us say you see one fascia with the green I am drawing here. This fascia, where it is located? On the top. This fascia is called as superior fascia or superficial fascia, right? Next, there is another fascia which I am drawing down. This fascia is called inferior fascia or perineal membrane. Okay, what are these two fascia called? This fascia over here is called as superficial fascia or superior fascia. This fascia over here is called as perineal membrane. What is this called? Perineal membrane. Okay, now within this deep perineal pouch, what are the muscles you have got? You have got two important muscles. Okay, so let us say, see, this is one particular muscle located over here and this is another muscle. Okay, so what are these muscles? There are two important muscles over here. So what are these muscles that are located over here? So what are these two important muscles? Are one muscle is called as a sphincter urethra muscle. What is that called? Sphincter urethra muscle. And the other muscle over here is called as deep transverse perineum muscle. Okay, so there are two muscles. See, this particular muscle over here is called as sphincter urethra muscle, and the next one over here is called as deep transverse perineum muscle. Okay, deep transverse perineum muscle. Now look here, sphincter urethra muscle, deep transverse perineum muscle, right? Superficial fascia or superior fascia, inferior fascia or perineal membrane. All these four important structures together, you call it as urogenital diaphragm. Okay, all these important structures together, you call this entire part as what? You call this as urogenital, dx in the sense of diaphragm. Just remember it as diaphragm. Okay, not diagnosis. This is diaphragm, urogenital diaphragm. Okay, next, in the penis, what are the additional structures you have got in the penis? For example, see, in the penile region, here you have got a part. What is this part of the penis called as? Yes, what is this part of the penis? This is actually a muscle. What is this muscle? Bulbospongiosus muscle. Okay, so the name of this particular muscle is bulbospongiosus. I will write down these things later. In the same way, you even have got two more muscles like this. So here there is one more muscle over here. Here there is another muscle. What are these two muscles over here? These two are called as ischiocavernous muscle. Okay, so there are two important muscles over here. This one is called as bulbospongiosus, and this is called as ischiocavernous, bulbospongiosus and ischiocavernous muscle. Okay, now these muscles also should be covered by a fascia, right? So there is also a fascia over here which you can see. You see, this is a fascia. What is this fascia that is covering here? This is called as Colles fascia. What is this fascia called? Colles fascia. This fascia is called Colles fascia. And this entire compartment which you can see over here, this is called as your superficial perineal pouch. Superficial perineal pouch. So you have got two pouches over here. What are the two pouches? One you have got is a deep perineal pouch, another one is called as a superficial perineal pouch. Then tell me, what is this particular tissue over here called? On both the sides, within this ischiocavernous muscle, what is this called as? This is called crus of the penis. What is this called? Crus. And what is this part of the penis called as? This is called as your bulb of the penis. Okay, so you have got two important structures. This is called as the crus of penis, and this structure is called as your bulb of penis. Bulb of penis. So you have got crus of penis and bulb of penis. So these are some of the very important structures which you need to understand. You need to practice this picture so that it would be easy for you to understand the structures which I am writing now, which I will be writing now. And what is this particular structure? This is the urethra. Where is this urethra located? In the bulb of the penis. Urethra in bulb of penis. Urethra in bulb of penis. Urethra in the bulb of penis. Now let us discuss about superficial perineal pouch. Perineal pouch. So why am I not, this superficial perineal pouch is present in females also? Yes, it is present in females also. Then why are you not drawing? Because once if you understood the picture of superficial perineal pouch in males, right, then it will be very easy for you to understand the structures that are located within the superficial perineal pouch in females. So here it was the males, we'll discuss it in the males, and here females. Very slight differences in the sense differences in the names only. Okay, coming to the superficial perineal pouch over here. So first, in the males, what are the structures that are located in superficial perineal pouch? See, let me draw this line. You see this line which I am drawing? So this entire structure is superficial perineal pouch. What do you have over here? See, do you have what is this? This part, this dotted line, whatever I have drawn over here, these blue color dots, don't you think this is called as what? Bulb of the penis? Yes or no? So bulb of the penis is covered by which muscle over here? Bulbospongiosus muscle. So can I tell bulb of the penis and bulbospongiosus, both of them are located in the superficial perineal pouch? Yes. So one is bulb of penis covered by what? Covered by bulbospongiosus muscle. So that is located in the superficial perineal pouch, right? When it comes to females, the story is different. Okay, here you are calling it as bulb of penis, but there you have to call it as bulb of vestibule. So bulb of penis is covered by bulbospongiosus. There it is bulb of vestibule covered by bulbospongiosus. So only one difference. For that, why to draw a picture? So bulb of vestibule covered by bulbospongiosus muscle. Now let us look at the next structure in the males. Right, now look at this particular structure. What is this? What are these blue dotted lines on either side? What is this? This is called as a crus of the penis. Right, or crura of the penis or crus of the penis. So this crus or crura of the penis is covered by which muscle? What is this particular muscle? Ischiocavernous muscle. Okay, so crus or crura of penis covered by ischiocavernous muscle. Cavernous muscle. Now let us look in case of females. In case of females, it is not crura of penis, rather it is crura of clitoris. So here crura of penis covered by ischiocavernous, there it is crura of clitoris covered by ischiocavernous. Crura of clitoris covered by ischiocavernosus. Okay, crura of clitoris covered by ischiocavernosus muscle. Clear? Right, coming to the third important structure. What is the third important structure which you have got over here? See, what is this particular string? This, first of all, what is this gland over here? This is your bulbourethral gland. But bulbourethral is not located in superficial. It is located in your deep pouch. Okay, but what is located in the superficial pouch? This duct. You see the duct. Where is the duct located? The duct is located in the superficial perineal pouch. So duct of bulbourethral glands, they are located in the superficial perineal pouch. Third important thing is ducts of bulbourethral glands Ducts of bulbourethral glands are located. But remember one thing, bulbourethral glands are equivalent to Bartholin's glands in females. So in the females, what do you have? You have directly have got the Bartholin's glands. See, very, very important thing. Here I have spoken about ducts. Here there are no ducts. Directly glands itself are located in the superficial perineal pouch. The other name which you can give for this is vestibular glands. Vestibular glands. Vestibular glands. 4. The fourth important thing. What is the fourth important thing? Fourth important thing is that you see what is this? Urethra. Where is the urethra located? Urethra is located in the bulb of the penis. You see urethra located in the bulb of the penis. So write down here that urethra in bulb of penis. But here you have got urethra alone. Okay, you have got the urethra. Next, coming to the fifth important structure. What is the fifth important? I did not draw here. What is there? If I have to draw an artery, I will just draw a dot like this and tell this is an artery. No, that doesn't any signify this image. Yes or no? So instead of drawing a dot and telling that an artery, instead of drawing a blue color dot and telling a vein, instead of that, I'll just write it here. Right? So in the males, in the superficial perineal pouch, what do you have? You have branches of what? Internal pudendal artery. Branches of internal pudendal artery. Next, sixth important thing is that you even have got branches of internal pudendal nerve. Branches of internal pudendal artery and branches of internal pudendal nerve. So here also you have got branches of internal pudendal artery. Here also you have got the branches of internal pudendal nerve. Okay. So internal pudendal artery and internal pudendal nerve. What do you mean by branches of? What are the exact branches? You are telling branches of. Then what are the branches? So branches of internal pudendal artery branches are basically 3. We have got 3 branches. What are those 3 branches over here? One branch is called as a perineal artery. One artery is called as a perineal artery. Next we have got is the dorsal artery of penis. Third we have got is a deep artery of penis. So how many are there? 3. What are those 3? Perineal artery, dorsal artery of penis and deep artery of penis. Now will you also write penis over here? No. So what are the branches over here then? Internal pudendal artery branches. Here also there will be 3. What will be these 3 branches? One, perineal artery is common. Dorsal artery of penis, but here you will write as dorsal artery of clitoris. Here there is dorsal deep artery of penis, then here you will write deep artery of clitoris. Okay. Then you also told branches of internal pudendal nerve. Tell me what are the branches of internal pudendal nerve? Internal pudendal nerve branches. There are only 2 branches. What are these 2 branches? Same like perineal artery. We have got perineal nerve. Same like dorsal artery of penis. We have got dorsal nerve of penis. Now you guess what will be the names here. Yes, that is IPN, internal pudendal nerve. Again here also 2. Then tell me now what will be the 2 nerves over here. Perineal nerve is there, so here also there will be perineal nerve. Here there is dorsal nerve of penis, then here it will be dorsal nerve of clitoris. So I don't think so. Really we need images for the female pouches to understand these structures. Right? So this single image is so important that with this single image you can cover superficial perineal pouch contents in males and females. You can even cover, just now we discussed, you can even now cover, I will discuss now that the deep perineal pouch contents in males and females. So we are done with superficial now. We are done with superficial. Now let us discuss. Now let us discuss about the deep structures over here. Now let us discuss about the deep structures, that is a deep perineal pouch. Deep perineal pouch. So deep perineal pouch, what are the structures of deep perineal, contents of deep perineal pouch in case of males, in case of females, okay, males and females. Now in case of males, what do you have? First important structure in the deep, what can you see? Tell me, what is this part of urethra? This part of urethra is called as membranous urethra. What is that? Membranous urethra. So I did not write it here. Let me write. This part of urethra is called as membranous urethra. Membranous part of urethra. Okay. So in the males, you have got the first important thing in the deep, that is membranous part of urethra. Membranous part of urethra. Now, tell me, what are the structures that are located in the females? Here you will just have urethra. There is no membranous bulbar part here, right? You just have urethra and vagina. Urethra and vagina. Okay. Next, I told you two important muscles are located. What are the two important muscles? One is called as sphincter urethra muscle. Sphincter urethra muscle. And what is the other muscle I told you? I told you that deep transverse perineum. What is that? Deep transverse perineum muscle. Okay. So again, here also put down the same things over here. Here also you have got same important things. So what are these same things that are located over here? Yeah. So what are the same things that are located over here? So here also we have got the sphincter urethra and the deep transverse perineum muscle, right? What is the third important thing we have got? Third important thing which we have got over here, where is the picture? Yeah, here we have got these glands. What are these glands over here? These glands are bulbourethral glands, right? Previously we discussed ducts. Now we are directly discussing bulbourethral glands. So what did I tell you? I told you bulbourethral glands are equivalent to what? Equivalent to Bartholinus glands. But already we discussed in the superficial, we discussed Bartholinus glands here. So do you think will there be any gland now here? No. So here simply write it as no glands, because these glands are already discussed in the superficial pouch. Okay. Next, after that, the fourth important thing. What is the fourth important thing over here? We have got the arteries now. So what are the arteries again? You have got the same. What are this? Branches of internal pudendal artery, branches of internal pudendal artery, branches of internal pudendal nerve. Here also branches of internal pudendal artery and internal pudendal nerve. So let me copy and paste. So we will discuss the branches of internal pudendal artery and nerve. The same things, no changes here. The fourth and the fifth thing, okay. So we have got the branches of internal pudendal artery as well as nerve. So guys, these are the contents which you have in the males and females regarding the superficial perineal pouch, and regarding deep perineal pouch, these are the contents that are located in the males and females. So this is all you need to know regarding the perineal pouch. So now we shall be discussing regarding the perineal body. Okay. We shall be discussing regarding the perineal body right now. So regarding this perineal body, what is the important thing you need to know is that perineal body is a fibromuscular tissue. Where is that located? That is located exactly in the midline of the urogenital and anal triangle. Okay, let me show this to you. That where is your perineal body? See, you know there are two triangles, right? What are those two triangles? The top one is called as anal triangle. The front one over here is called as a urogenital triangle. So between the urogenital and the don't confuse. You see, this is the sacrum over here. So this is the posterior side. This is the pubic symphysis over here. So anterior side. So this is your urogenital. This is your rectal triangle, anal triangle. So exactly in the center over here, exactly the junction of both the triangles, This is what is called as your perineal body. Now what we will do is that we shall discuss, we will draw a picture together and we shall discuss what are the muscles that are attached to the perineal body. But before that, write down the definition. This is a fibromuscular tissue. This is a fibromuscular tissue in the middle. Fibromuscular tissue in the middle at the junction of both the triangles, that is your urogenital and anal triangle. Urogenital as well as your anal triangle. So let us look, first of all let us look in the males, then we will discuss the muscles that are attached in the females over here. So there won't be much difference over here, and you know this picture, right? So what is this picture, guys? Tell me, what is this particular structure over here? This ligament of what is this? This is your what? Arcuate inferior pubic ligament or arcuate ligament. Arcuate ligament, right? So this is your inferior pubic ligament or arcuate ligament, and this is a conjoint, right? Conjoint. And here we have got the sacrotuberous ligament. This is your sacrotuberous ligament over here. Now, for example, if I am drawing a dotted line touching two ischial tuberosities, you know, this is your ischial tuberosity. Ischial tuberosity. I am drawing a dotted line, an imaginary line touching two ischial tuberosities over here. So what did I tell you? Here you have got this triangle anteriorly is called as urogenital. This triangle posteriorly is called as a rectal triangle. Okay. So in between both of them, exactly this junction, you have got this body over here. This is called as your perineal body. What is this? Perineal body. Now let me draw this thing. Now above and below, what are the muscles you have got? So above here you have got a very important muscle. You see, this is your urethra and the penis, right? So down here you have got a muscle like this, which is attached to, you see, it is attaching to the perineal body. So what is this particular muscle over here? This particular muscle over here is called as your bulbospongiosus muscle. You remember now? Right, bulbospongiosus. Now tell me, where is bulbospongiosus located? In the superficial perineal pouch or deep? Look at the picture here. Where is bulbospongiosus? This one is your bulbospongiosus, located in superficial perineal pouch. Okay, superficial perineal pouch. What is this bulbospongiosus doing? It is completely surrounding which part of the urethra? You see this bulb region of the urethra. This is surrounding the bulb region of your urethra. So this is your bulbospongiosus muscle. Right. Next important thing is that on either sides of the perineal body, you have got another muscle like this. You see this muscle on either sides of the perineal body. Now tell me, this muscle is vertical or it is horizontal? It is horizontal, transverse. So this is called as deep transverse perineal muscle. What is this? Deep transverse perineal. Now when I tell deep, there should be opposite word called as superficial. So here actually you have got the superficial transverse perineal. See, actually here you have got the superficial transverse perineal muscle like this. You see, there is superficial transverse perineal. Behind that you have got the deep transverse perineal. So this is your deep transverse perineal muscle, and this is your superficial transverse perineal muscle, deep and superficial transverse perineal muscle, and this is your anal region, right? Anal region with a muscle like this, right? So this is your anal region with a sphincter, right? Now repeat. And this is your anal region over here. Okay, this is your anal region over here. Now surrounding the anal region also you have got a muscle. What is this? This muscle is called as sphincter ani muscle, and this is located outside the anal region, right? So externus, sphincter ani externus. What do you call this as? You call this as sphincter ani externus. And next important thing is that on either sides like this you have got a muscle. You see, on either sides You have got a muscle like this. You know what is the name of this muscle? This muscle is called as the levator muscle. What is this? Levator ani muscle. Okay. So there are two muscles over here. This is your levator ani and this is your sphincter ani externus. Sphincter ani externus. Ani in the sense anus. Sphincter ani externus. Sphincter ani externus. So how many okay, tell me how many bulbospongiosis? You did not write this. So this muscle over here is your bulbospongiosis. Bulbospongiosis. How many bulbospongiosis you have got? You have got two bulbospongiosis, right? How many deep transverse perineum on either sides? Two. Superficial, two. Sacrotuberous, two. Right? So these are some of the important things which you need to know over here. Now when it comes to females, what are the structures here? So first important structure. Let us start with the first important part here. This is your clitoris. Okay. Next, just below the clitoris, what is this? This is your urethra. Okay. Beneath the urethra, what is this particular structure? This is called as your vaginal orifice. Vaginal orifice. And posteriorly, as usual, you have got your anus. Now, if you look at the muscles over here, we have got two important muscles. So here, just look at this muscle which I am drawing right now. You see this muscle? You know what is the name of this muscle? This is called as ischium muscle. What is this? Ischium muscle. As if you remember me telling that here, right? You see this? Crura of the clitoris covered by ischiocavernosus. The clitoris is covered by what? Ischiocavernosus. So it means this is the clitoris that is covered by what is this muscle? Ischiocavernosus. Right? And the next important thing is urethra. Right? So let me first name these parts. So this part over here is called as your clitoris. This is your urethra. This is your vagina. And here you have got your anus, right? This is your anal opening or anal canal, okay, right? What is the second important muscle? There is a second important muscle here. You see, this second important muscle is closing, it is completely looping your vagina like this. You see, what is this muscle over here? This is called as your bulbospongiosus muscle. So this muscle over here is your bulbospongiosus muscle. Okay, so this is your bulbospongiosus muscle. Okay, what is this? This is your bulbospongiosus muscle. Next important thing is that transversely there are two muscles. What are these two muscles which are located transversely like this? This is called as superficial transverse perineum. What are these two muscles? Superficial transverse perineum. Superficial transverse perineum muscle. And next important muscle is, this is the muscle that is surrounding your anus, that is your external anal sphincter. Okay. So this is the muscle that is surrounding your anus, acting like a sphincter over here. This muscle over here is your external anal sphincter. This is your external anal sphincter over here. Now, why did I tell you here is that here you have got your perineal body. This is the location of perineal body. Now, in males, what are the muscles that are attached to perineal body? You know. Now, in the females also, what are the muscles that are attached to the perineal body? You can know. Right. Next important thing I want to show you here is that, let me remove the perineal body and now show you this important thing, that during the delivery, the baby comes out of the vagina. Right, but sometimes the baby's head is so big, or sometimes even during normal deliveries, normally what you do is that if the vagina is small, right, the opening of the vagina is small, it will be very difficult for the baby to get delivered out. So in that case, what we do is that we widen the area. Okay, so what we basically do, we widen that area, that vaginal orifice, whatever is there, we enlarge that vaginal orifice to facilitate the childbirth. How will you enlarge this vaginal orifice? What you will do is that you will take a scissor, and during the delivery, you cut this region like this. You see, you are cutting this. Okay, when you cut this region, what is happening? So see, from the vagina all the way you cut it down. So when you cut it down, what is happening overall? See, this entire region is now open. You see, this entire region is now open. You see, the canal has become very big now. Now the baby, it will be easy for the doctor to deliver the baby. So this procedure of making an incision is called as episiotomy. So there are basically two different types of episiotomies here. So one incision which you made exactly in the center is called median episiotomy, right? Another one which are making on the side like this, this is called as mediolateral episiotomy. There are two important episiotomies. What are those two important episiotomies? See, this is called as median episiotomy, and this is called as mediolateral episiotomy. Median episiotomy and mediolateral episiotomy. Okay, so these are the two important episiotomies which you basically do over here. So these are the two important questions which will be asked. What are the muscles that are attached to the perineal body, right? So we have discussed the muscles attached to the perineal body. So what muscles are attached to perineal body in case of males? In case of males, right, and in case of females. In case of males and in case of females, what is the muscle that is attached to the perineal body is very, very important. Okay. Now the next important thing we shall be discussing is nothing but your isio-anal fossa. Isio-anal fossa. You also call this isio-anal fossa as isio-rectal fossa, right? So this is your isio-rectal fossa. So isio-anal fossa or isio-rectal fossa, both of them are the same. Both of them are the same. Now you remember this, that surrounding the anus. Yeah, let me show it to you here itself. This is your anus. Surrounding the anus, this space whatever you have, okay, remove the muscle. This space whatever you have is your isio-anal fossa or isio-rectal fossa, right? I have shown it to you here. You see this one, right? So why is this important is that there are infections that can develop in this region. So you have to know what is this region first of all, and you have to know what are the borders of this region. So when I tell isio-anal, right, it means I have to draw a picture of anus first, then I have to draw the spaces side to the anus. Yes or no? So first what I will do is that I will draw the anus over here. So here this is the anal opening. Now whatever muscle right now I am drawing here, right, you see this is the anus which I am drawing, two walls of the anus, right? So whatever muscle which I am shading right now over here, this is your circular muscle of the anus. What is this muscle? This muscle is your circular muscle of the anus. I mean your circular muscle of your rectum. Okay, rectum will continue as anus, right? So this is your circular muscle of your rectum. Now after this circular muscle of the rectum, there is an other muscle. Just look here, there is an other muscle just behind this circular muscle. This is called as longitudinal muscle. What is this muscle? This is called as your longitudinal muscle. So I will label the names later. One is called as circular muscle of the rectum, another one is called longitudinal muscle. Now this area, you can see this line that is I am drawing touching the free margins of the anal region, this is called as white line of Hilton. What is this? Hilton. So this is called as white line of Hilton. White line of Hilton. Next important thing is that on either sides of the anus, here you have got a muscle. And by the way, tell me, surrounding the anus you have something called as sphincter. Just now here I told you, you see, surrounding the anus, what is this? This is the anus. Surrounding the anus, what is this sphincter? External anal sphincter, right? So surrounding the anus, we have got external anal sphincter. Actually, external anal sphincter is collection of three muscles. Okay, so let us say this is one muscle, this is a second muscle over here, and down here you have got the third muscle. Again the same. right? So you have got three muscles over here. Three muscles. So these three muscles together you call it as external anal sphincter. What are these three muscles over here? One is called as a deep muscle, one is called as a superficial muscle, another one is just beneath the skin, you call it as a subcutaneous muscle. Subcutaneous muscle. So the deep muscle, superficial and subcutaneous together you call them as external anal sphincter. External anal sphincter. And what did I tell you? I told you that this is a circular muscle of rectum, circular muscle of rectum, and this one is the longitudinal muscle of rectum, circular muscle and longitudinal muscle of your rectum. Next important thing is that on either sides of the anus you have got a very important muscle. See, you have got a very important muscle like this. So this is a group of three muscles. Again, what is this? This is your levator ani muscle. So it is located on both the sides. Levator ani on the right and on the left. So here also you will have the levator ani on the other side also. Next important thing is that here you have got a tuberosity called as ischial tuberosity. See, this is a bone, right? This is a bone over here, and here you have got a tuberosity here, right? So this particular tuberosity which you can see, this particular tuberosity which you can see over here, this is your ischial tuberosity. Attached to this ischial tuberosity, you have got a muscle like this. This muscle over here is called as your obturator internus muscle. Okay, so this muscle over here is your obturator internus muscle. Okay, so let me label for some time before I proceed. So this is your levator ani muscle. This is your obturator internus muscle. Now I am drawing two potential areas. Okay, so what are those two potential areas? See, one area is coming down all the way like this. The same area is present on the opposite side, and there is another area in this way. Okay, so what are these two areas, guys? So this area which you can look on the top, see this yellow color area which you can see on the top over here, this area is called as isio-anal or isio-rectal fossa. What is this? Isio-rectal fossa. Next, what is this particular area over here? This is called as perineal region. What is this? Perineal space. Perineal space. So what are the two important regions over here? The top one is called as isio-rectal space. The lower one is called as perineal space. Okay. The top one over here is called as the isio-rectal space. This one over here is called as the perineal space, isio-rectal space and perineal space. Now you see this levator ani muscle, obturator internus muscle, don't you think these are surrounded by a fascia over here, right? See, perineal space is also there. Don't you think these are all surrounded, should be surrounded by a fascia? For example, this particular perineal space is surrounded by a fascia like this. You see, this perineal space is surrounded by a fascia called as perineal fascia. For example, this obturator internus is also surrounded by a fascia called as obturator fascia. For example, this levator ani is also surrounded by a fascia here is called as inferior fascia of levator ani, because below the levator ani there is a fascia, so inferior fascia of levator ani. Okay. In the same way, there is a fascia that is surrounding your isio-rectal space. You see, there is a fascia that is surrounding your isio-rectal space. This particular fascia, isio-rectal space, and that is joining with what? That is joining with your fascia of obturatus internus. This particular fascia is called lunata, fascia lunata. Let me write these things down. So what is the first important fascia we have got over here? What is this fascia? Yes, what is this fascia called as? This fascia is called as inferior levator ani fascia. Okay, and this particular fascia over here is called as obturator fascia. okay, and this is called as perianal fascia, perianal fascia. And what is this fascia over here is called? This is called as your fascia lunata, fascia lunata, fascia lunata. Okay, this is called as your fascia lunata. So these are all the important things which you need to know regarding the ischiorrectal fossa. Now what we will do is that we shall discuss about the borders. What are the borders of this ischiorrectal fossa over here? The first important border, if you look at the roof of this, what is this? The top one over here is called as a roof. If you look at the roof, roof is having what muscle? Levator ani muscle. What is that? Levator ani muscle. Next, down here, floor. What is the floor having? Floor is having perineal fascia, but this part of the perineal fascia is transverse. So you call it as a deep transverse perineal fascia. Deep transverse perineal fascia. Next, if you look at the medial wall, see this entire wall is a medial wall. Medial wall is consisting of again a part of levator ani, and also what are these muscles? External anal sphincter. External anal sphincter and levator ani you have got. Lateral wall, what is this? This is the lateral wall. Lateral wall is consisting of what is this? Ischial tuberosity. You have got obturator internus muscle. You have got a fascia that is covering obturator internus, that is called as obturator fascia. Okay, obturator fascia. What is the apex? See, this part is called as the apex. What is the apex here? Apex is consisting of the intersection, the joining of both the levator ani fascia and obturator internus muscle. Okay, so what is this? Not the fascia, the muscles itself. So what is the apex consisting of? Apex is consisting of the intersection. You see this intersection between the levator ani and obturator internus. And what is base consisting of? In the base we have got two borders. One is called anterior and posterior. Okay, anterior and posterior. Now in base you cannot see in this particular picture. It would be better here. Okay, it would be better here. So this entire thing is a base, right? Why you are calling it as base? Because this is a picture looking from below, base, right? So in the base, okay, let me show it here. So this entire thing over here is your base. Now what is base consisting of? Superiorly, anteriorly, posteriorly. Anteriorly what do you have? Perineal body, right? Posteriorly what do you have? What is this? Sacrotuberous ligament. I hope you understood now. Now let us keep on writing the things. So first important thing, what is a roof consisting of? Roof is consisting of levator ani muscle, levator ani muscle. Floor is consisting of deep transverse perineal fascia, deep transverse perineal fascia. Medial wall is consisting of external anal sphincter, and there is levator ani muscle, levator ani muscle. Lateral wall is consisting of ischial tuberosity. It is consisting of what? Ischial tuberosity. It is consisting of obturator internus and a fascia covering it. Obturator internus muscle and its fascia, okay, and its fascia. Apex is what? Apex is consisting of intersection. Okay, what is that? It is consisting of intersection of levator ani and obturator muscle, right? Obturator internus muscle. Coming to the base, we have got two parts. Base is having anterior and posterior. Anteriorly what do we have? We have got the perineal body, right? So remember it as the posterior body of, right, the posterior, repeat. Anteriorly what do we have? We have got the perineal body. And posteriorly what do we have? We have got the sacrotuberous ligament. Sacrotuberous ligament located posteriorly. Now let us discuss what are the contents over here. What are the contents of this particular ischiorrectal fossa? So this contents, you just have to remember with the letter P. What is P? So P stands for there is a pad of fat. What pad of fat? Isio-rectal pad of fat. Next, P stands for perineal branch. Perineal branch. Okay. P stands for perineal branch of S4. Next, you even have got P. P stands for Pudendal canal. P stands for Pudendal canal. Within this Pudendal canal, what was there in the starting? I told Pudendal nerve, you remember, which is passing through the Pudendal canal. So it is consisting of what? Pudendal nerve and internal pudendal vessels. Internal pudendal vessels. Internal pudendal vessels. Okay. Now, when I tell pudendal nerve, specifically remember that the inferior rectal branch. Okay, inferior rectal branch. So these are the contents which are located within the isio-rectal fossa. Isio-rectal fossa. Now, why this is very important is that sometimes within these spaces there are abscesses that are formed. There can be abscess that can be formed here. Not only here, there are multiple places surrounding this anus, surrounding this anal ring. There are at multiple places where abscesses will be formed. Let us see what are the different abscesses over here. You see the picture now? The same picture. See, this is your isio-anal fossa, and what is this one over here? This is called as perianal fossa, right? You see, these are your ischial tuberosities, and what is this? Obturator internus muscle, right? And tell me, what is this muscle? What is this? Levator ani muscle. And what is this muscle over here on either sides? Sphincter, right? External anal sphincter divided into three. Here we have got the deep, here we have got the superficial, and down over here we have got what? We have got, what we have got here? Subcutaneous. Now, if there is an abscess, see, abscess, if it is formed within the isio-rectal fossa, you call it as isio-rectal abscess. So, first abscess which we will discuss is isio-rectal abscess. Second, you see, this is your levator ani muscle. Above the levator ani muscle, if an abscess is formed, this is called as supralevator abscess. Supra, above. Next, in the perianal region, if perianal, why? Because this region is called as perianal space. In the perianal space, if there is an abscess formed, that is called perianal abscess. And finally, what are these muscles? External anal sphincters. So in between the sphincter muscles here, if an abscess is formed, intersphincteric abscess, you call this as C. This is called the last one, that is your intersphincteric abscess. So how many abscesses are there? We have got 4 important abscesses over here. One is called as isio-rectal abscess. Isio-rectal abscess. You have got the perianal abscess. Perianal abscess. You have got the intersphincteric abscess, and you have got what? Intersphincteric and supralevator abscess. These are the different abscesses that are located in the isio-rectal fossa. So now after this isio-rectal fossa, now we shall be discussing regarding the uterus. One more important topic, that is the uterus. So what are the important points you need to remember in the uterus for your exam? So first important thing is that, let us go from the basics. This is a secondary sexual organ, you know. This is a secondary sex organ. So you should remember what is the important thing regarding the uterus is that the uterus is responsible for implantation. You know, it is responsible for the implantation. Embryologically it is responsible for implantation, you know. Next important thing is that this is responsible for maintenance and transport of your gametes. It is gametes even pass through this, then fallopian tubes, then down to the ovaries. So it is responsible for maintenance and transportation of gametes. Responsible for maintenance and transportation of gametes. So let us start from the basic thing, that what are the different parts of your uterus. So if you look here, this is called as the fundus of the uterus, this is called as the body of the uterus, and this is called as the cervix of the uterus. And you know, this is the vagina over here. right? But anyways, that is not the part of the uterus. So we have got three important parts. One is called as a fundus, body, as well as the cervix. So from the lateral aspect, if you see, this is the uterus over here. You see where is the vagina located in this picture? You see this is the vagina over here, right? And this is a bladder, and this is your uterus. Okay, now there are two important statements, that uterus is anteverted, uterus is flexed. What do you mean by uterus is anteverted? Basically the shape of the uterus, it depends upon the urinary bladder. Why? First, why uterus is anteverted? Why uterus is anteverted in the sense, see, normally if you look at the uterus, is the uterus straight like this? No. How is the uterus? Uterus is bending forward, right? So uterus is normally rotated forward. All of you know that this is your anterior abdominal wall, back is a posterior abdominal wall. So uterus is bending forward towards the anterior abdominal wall. Yes or no? It is simply lying forward onto the anterior abdominal wall. That is why you call uterus as anteverted. Why do you call it as anti-flexed? Why do you call it as anti-flexed is that normally, if you look here, this is your urinary bladder. Okay, this is your urinary bladder over here. Now, where is your uterus? This is the uterus over here. This is the uterus over here. For example, if bladder is full of urine, don't you think the bladder will stretch? Right? Now, when the bladder is stretching from all the sides, don't you think this bladder will create some kind of bend within the uterus like this? See, once the bladder is stretching, don't you think that at this region, the bladder will create a bend like this? Right? You see, this is the stretched bladder. Now the bladder is stretched because of the urine. Now because of this urine, the bladder is stretched. Now don't you see, now the uterus is flexed at this region. So it is again, it is flexing where? It is flexing towards the anterior surface of the body. There is no backward flexion, there is forward flexion. See, usually uterus is like this. Uterus is like this. Right? So this is called as anteverted. Why it is anteverted? Because normally uterus is towards the anterior surface. This is the anterior surface, this is the posterior surface, towards the anterior surface. Now here is the bladder. If the bladder is stretching, what will happen? There is a small bump that is created. There is a small bend that is created. Previously it was like this. Now you see a bend. Again, even after bending also, it is looking towards the anterior surface of the body. So you call it as anti-flexed. Okay. So that's what I was telling you, that the uterus is normally, right, it is normally rotated. How it is rotated? It is normally rotated forward towards what? Towards the anterior surface of the body, towards the anterior. It is normally rotated towards the anterior surface of the body. That is why you call it as anteverted. Now, why do you call it as anti-flexed? Why do you call it as anti-flexed? Because it is flexed towards the anterior surface of the body. Because it is flexed towards anterior surface of the body. That is why you call it as anti-flexed over here. But there are some abnormal positions of the uterus. For example, if you look at this, this is a normal position. How is this normal position? Uterus is looking forward, it is bent. You see there is a flexion also here. So it is anti-flexed and anteverted towards the anterior abdominal wall. Right? Now in some conditions, what can happen is that this is how the uterus can be. Okay. Now this is your anteverted uterus. This is your anteverted uterus. I already told you, anteverted and anti-flexed. Now there is another condition. Just look here. In this condition, you see the uterus is here, right? Slowly from anteversion, it is going back like this. So this is slowly retroversion is there. It is going little bit back, retroversion, and here there is complete retroversed. Okay. So if the uterus is going towards the back, you call it as retroverted, and once it went back like this completely, you call it as retroflexed. You see there is a flexion over here, but do you see any flexion over here? You don't see any flexion. Okay, so this is the important thing, you know, these are what? Retroverted and retroflexed are the abnormal uteruses over here. Now what will happen in these cases? Okay, what is happening if it is retroflexed or whatever it is? What will happen is that if the uterus is straight like this, if there is increased abdominal pressure, don't you think this uterus, because of increased abdominal pressure, because of increased pressure in the abdomen, this increased pressure will fall on the uterus, and this uterus, if it is straight, don't you think this uterus will prolapse down here into the vagina? Yes or no? This pink color one is your vagina. So I mean, you see, don't take me wrong, they have drawn the color as pink. Okay, so if the uterus is because of increased intra-abdominal pressure, what is happening? This uterus is prolapsed in the sense it comes inside the vagina. So abnormal position of the uterus will lead to what? Uterine prolapse. Abnormal position of the uterus will lead to uterine prolapse. Now if you look at what are the layers, uterus is very thick, right? What are the layers of the uterus? First we shall mainly discuss this part. Okay, in the uterus, this is the major part over here. This is called as a fundus. If you look at the fundus of the uterus is having three important layers. What are those three important layers over here? The outermost layer is called as peri, right? Middle is myo, inner is endo. So you call it as perimetrium, right? You call it as myometrium, perimetrium, myometrium, and the innermost is called as endometrium, perimetrium, myometrium, and endometrium. Now if you look at, I will also show you the real histological picture. If you look at perimetrium is not single layered, it is actually double layered. You know, perimetrium is actually a double layered membrane. Okay, and this perimetrium is continuous with the abdominal peritoneum. Just look at this particular picture. Okay, now in this particular picture there are three layers. See this, if I zoom in clearly, just look at this. See this layer all the way till this dotted lines, whatever I am drawing over here, this part over here is called as perimetrium. This perimetrium is attached to what? It is continuous or attached to the abdominal peritoneum, right? You see here we have got the peritoneum like this. What is this? Visceral peritoneum, and this visceral peritoneum will continue forward as the peritoneum that is covering your anterior abdominal wall, right? So this particular perimetrium is in continuous with the visceral, it is continuous with the abdominal peritoneum. Next layer of peritoneum is here. You see this layer of peritoneum here? This one, this layer of peritoneum is called as myometrium. What is this? Myometrium. And inner, this is called as your endometrium. Okay, this is called as your endometrium. In the endometrium also you see two layers. Okay, see here, this is called as superficial layer, this is called as a deep layer. Clear all of you? So how many layers do we have over here? Here we have got perimetrium, we have got myometrium, we have got endometrium. Coming to the myometrium. Myometrium is nothing but your muscle layer. Yes or no? There is a smooth muscle layer over here. Now when it comes to endometrium, endometrium is inner layer, inner mucous membrane lining layer, inner mucous membrane lining layer is endometrium. If you look at this picture here, see this inner layer, whatever I am drawing here, the mucous membrane which is lining here, this is called as your endometrium. Okay, now within endometrium, as I just now told you, there are two important layers over here. One is called as a deep layer, another one is called as what? Superficial layer, superficial and deep layer. So you call it as deep stratum basalis, deep stratum basalis. The next one you called as superficial stratum functionalis. Functionalis in the sense it is responsible for some kind of function. What is that? We will see. Now during menstruation, all of you know that the epithelium that is lining the innermost layer, this epithelium is shed off. You know this, right? Now out of it means which layer epithelium is getting shedding off? That is your endometrium. Within endometrium, exactly speaking, which layer gets shed off? Not the deep stratum basalis. Deep stratum basalis is not shed. It is not shed during menstruation. It is not shed during menstruation. But the superficial stratum functionalis, whatever are there, this layer sheds during menstruation. Sheds during menstruation. Okay, and why it is called functionalis? Because this layer is responsive to hormones. For example, under the action of estrogens, there are two hormones, you know, estrogens. When I tell estrogens, you should also tell progesterone. Yes or no? So under the action of estrogens, what will happen with this layer? This layer will proliferate. This layer proliferates under the action of superficial stratum functionalis. And what is progesterone? Under the action of progesterone, this layer becomes secretory. This layer becomes secretory. Why are you calling it as secretory? Because this secretes some of the proteins, some glycogen and all. These are the things, some chemicals and all. So they secrete, this layer secretes this thing under the action of progesterone. Okay. So these are the three important layers which you see. Now coming to the uterus, there are some ligaments that are attached to the uterus. You can see here. Okay. So what are the ligaments? We will discuss. The first important thing. See, what is a ligament? The double layered fold of peritoneum, which I told you in the abdomen lecture. Watch that lecture before. In the abdomen lecture, I have told you the double layered fold of peritoneum, you call it as a ligament, right? For example, a double layered fold of peritoneum that is surrounding the uterus. Double layered fold of peritoneum. This is a uterus. This is a double layered fold of peritoneum coming and surrounding the uterus like this. That double layered fold of peritoneum is called as mesometrium. If there is a double layer of peritoneum that is surrounding your ovaries, this is called as mesovarium. Double layer of peritoneum surrounding your fallopian tubules, mesosalpinx. So we have got mesometrium, mesovarium, mesosalpinx. So mesometrium, what does it do? It surrounds your uterus. Mesovarium, it surrounds what? It surrounds your ovaries. And mesosalpinx, it surrounds your fallopian tubes. Now all these three ligaments together, they look very broad. So you call it as a broad ligament. Broad ligament of uterus. I'll show you this broad ligament of uterus here. You see this entire ligament here. You see this entire part which is shaded with the yellow here. This entire is a broad ligament of your uterus. It is having three parts. See, mesosalpinx, mesovarium, mesometrium. So together you call it as a broad ligament over here. So mesosalpinx, mesometrium and mesovarium together you call broad ligament. Okay. Next, there is another ligament called as round ligament of ovary. Sorry, you call it, repeat. There is another ligament called as round ligament of uterus. Round ligament of uterus. What is this round ligament of uterus doing? This round ligament of uterus attaches the, see, this is your round ligament of uterus. So it is attaching the uterus to your abdominal wall. Okay. So, but important thing to know is that from where this round ligament of uterus is derived, it is a derivative of gubernaculum. It is a derivative of gubernaculum. It is a derivative of your gubernaculum. Next important ligament is another ligament called as cardinal ligament. Cardinal ligament of the uterus. So where is this cardinal ligament? Just look here. So I'm zooming it here. Can you see this particular ligament over here? Within that ligament, can you see an artery, a vein also? Right? So this particular ligament over here is called as a cardinal ligament. Now look here, if this is a cardinal ligament, just above the cardinal ligament, there is a structure that is passing like this. What is this? That is ureter. Okay. So let me draw this thing. See, if this is a cardinal ligament like this. Right. So above the cardinal ligament, you see a structure that is passing like this. You see a structure that is passing like this. This particular structure is your ureter. Okay, and this is your cardinal ligament. Now what is this particular cardinal ligament consisting of? This cardinal ligament is consisting of both uterine artery and vein, because we are supplying to the uterus. So it is consisting of an artery inside, right? It is also consisting of a vein inside. So this cardinal ligament is consisting of uterine artery and vein. Okay, why did I tell this in relation with the uterus? Because whenever you are removing the uterus, you have to clamp all the arteries. Yes or no? If I wanted to remove the uterus, I have to cut all this. When I'm cutting all this, see, these are the ligaments, they don't bleed much. But if you look at this particular vessel, you have to clamp this vessel. But be careful that always clamp close to the uterus. Why? Because if you are clamping peripheral to the uterus here, you might have actually injured this ureter. And once if you injure the ureter, then the urine will drain. There is extravasation of the urine will drain, right, into the peritoneal cavity. So that is the reason why never ever do, whenever you are doing the surgeries, when you are clamping this particular ligament, these arteries and all, be careful, because there is a risk of ureteric injury. So here you have to write it down that there is increased risk of ureter injury. There is increased risk of ureter injury during what? Hysterectomy. During hysterectomy. Okay, but by the way, what is cardinal ligament doing? This cardinal ligament, from where it is attached? It is attached all the way from the cervix, right? This cardinal ligament connects the cervix. Repeat. So during hysterectomy. Okay, next ligament we'll discuss is the ovarian ligament. Ovarian ligament is surrounding your ovary, you know that, right? I'll also discuss about the ovarian ligament later on when I discuss about the ovaries, but remember that this is also a derivative of gubernaculum. Okay, so look at the ligaments over here. One we discussed was the round ligament. Next we discussed was the broad ligament. Now look here. This is the uterus. This is the uterus. From the uterus to the ovary, if from the uterus surrounding attached to the ovary, whatever ligament you have got over here, this is called as ovarian ligament. That is number 3. You see, ovarian ligament. Okay. Next important thing is that from this ovary, if there is any other ligament attached to the abdominal wall, it is attached to your posterior abdominal wall, right? So this ligament over here is called suspensory ligament of ovary. This is ligament number 4. You see, ligament number 3, ligament number 4. So all of you just look at this. See, this is your ovary over here. Before the ovary, what is this ligament here? This is called as your ovarian ligament. After the ovary, what is this ligament? Suspensory ligament of your ovary. Suspensory ligament of your ovary. Now let us look at the blood supply over here. Coming to the blood supply, there are 3 main arteries. Okay, you see, one is ovarian artery, next is uterine artery, third is vaginal artery. Remember this thing, that ovarian artery is a direct branch of abdominal aorta. So abdominal aorta direct branch is ovarian artery. See here, this is abdominal aorta, and what is this particular branch? This is your ovarian artery, which is a direct branch of abdominal aorta. Next, all of you know, if this is your abdominal aorta, it is divided into 2 common iliac arteries. Out of these 2 common iliac, you have got external iliac and internal iliac. What is this? This is your internal iliac artery. Now this internal iliac artery is giving 2 branches. What are those 2 branches? One is uterine artery, one is vaginal artery. Uterine artery, vaginal artery. So 3 branches. Ovarian artery, a direct branch of abdominal aorta, uterine artery, vaginal artery. And all these arteries you have to clamp during the hysterectomy. Okay. Now, next important thing over here is that regarding your ovarian artery over here. Okay. So the next important thing is that let us discuss about the ovaries over here. Let us discuss about the ovaries. Now coming to the discussion of ovaries, how long are the ovaries? Ovaries are around 4 centimeters long, right? If you look at the width, that is around 2 centimeters wide. If you look at the thickness, they are 1 centimeter thick. So 4 centimeters long, 2 centimeter wide and 1 centimeter thick. Where are ovaries present? Ovaries are present in ovarian fossa. This is called ovarian fossa of Valdier. Ovaries are present in the ovarian fossa of Valdier, ovarian fossa of Valdier. So let us look at the borders of this ovarian fossa. But before I draw the borders, you have to know that this artery over here is your common iliac artery. What is this? Common iliac artery. Common iliac artery divides into two. See, this particular branch over here, what is this branch? This is called as external iliac artery. Next, this particular branch over here is called as your internal iliac artery. This is your external iliac artery. This is your internal iliac artery. In the same way, here I have got a branch over here. This is a vein, common iliac vein. Common iliac vein is also dividing into external iliac vein, and then we have got what is called as your internal iliac vein. Okay, external and internal iliac vein. Now look here. Down, what do you have? Here you have got your urinary bladder like this. This is your urinary bladder. Okay. Now what I am doing is that I am just drawing the structure over here. Just look here. So this particular structure which I am drawing over here is your, what is this? This is your ureter. Yeah, what is this? This is your ureter. This is your urinary bladder over here. Ureter and the urinary bladder. Where is your ovarian fossa? So actually this is your ovarian fossa. What is this? This is your ovarian fossa. Within this ovarian fossa, you have got an ovary over here. This is the ovary that is located in the ovarian fossa. Okay. Next, there is a very important ligament over here, right? This ligament is called as medial umbilical ligament. Okay. What is this ligament? Medial umbilical ligament. And there is an artery over here. This artery is called as superior vesical artery. Okay, there is a ligament. This ligament is called as medial umbilical ligament. There is an artery here. This is called as superior vesical artery. Now let us discuss what are the posterior borders, what are the anterior borders, and what is the inferior border of this ovarian fossa, What is the posterior border? What is the anterior and inferior border of this ovarian fossa? Coming to the posterior border, now look here. Posterior in the sense back. Okay. Posteriorly, what do you have? What is this? This is the ureter. Not only ureter, back to the ureters you have got internal iliac artery. Back to that you have got internal iliac vein. Okay. It means internal iliac vessels. So posteriorly you have got ureter. You have got internal iliac artery and internal iliac vein. Anteriorly, what do you have? Anteriorly, what do I have? See, this is anterior. Anterior, I have got external iliac artery, external iliac vein. Anteriorly, I have got external iliac artery, external iliac vein. Inferiorly, what do you have? Down. Inferiorly, what do you have? You can't see the structures over here, but right now, inferiorly, you will have uterine tubes. Uterine tubes that are your fallopian tubes. Uterine tubes that are your fallopian tubes. Now, don't confuse uterine tubes with this one. This is urinary bladder. This is urinary bladder. Down you will have uterine tubes. In another view you will see. Just remember this as uterine tubes. Okay. If you look at the ovary, what are the layers you have in the ovary? So the first important thing is that we have got an outer layer. We have got a outer layer in the ovary. Outer layer is also called as a germinal epithelium of Valdier. Germinal is consisting of germinal epithelium of Valdier. So what kind of cells you have got here? You have got simple cuboidal cells. Simple cuboidal cells over here. After the outer layer, the next layer which you have is your capsule. This capsule is also called as tunica albuginea. Capsule is also called tunica albuginea. So what is this tunica albuginea consisting of? This is a thick layer of collagen. This is a thick smooth layer of collagen. thick and smooth layer of your collagen. Next important thing is that we have got the cortex. Then what is this outer layer and capsule? These are the outermost layers of the cortex. Okay, we have got the cortex. What is cortex consisting of? Dense connective tissue. Cortex is consisting of dense connective tissue. Now, along with this dense connective tissue, what is happening is that this dense connective tissue is completely surrounding some structures inside. So, let me show this to you. See, what is the outermost layer? I told you, germinal epithelium, which is consisting of simple cuboidal cells. See this outermost blue color layer. Just beneath that, you can say a radiant green over here. You see, this green color layer is called tunica albuginea. After that, you have got cortex and you have got medulla. What is cortex consisting of? What is cortex covering actually? This particular cortex, you see this thick layer. Okay, leaving this, let me, yeah, this is the thing, right? So this entire thing is the cortex. So what is this cortex covering actually? This cortex is covering these big structures over here. What are these big structures? Ovarian follicles. So this is a dense connective tissue with what? With ovarian follicles. Ovarian follicles and also corpus lutea. Corpus lutea. Next, after that you have got the medulla. Medulla is the innermost part. So what is medulla having? The loose connective tissue. If it is dense outside, then loose connective tissue is inside. With what? What is this loose connective tissue consisting of? You see artery, you see a vein, right? And also you see these small things called as nerves. So it is consisting of what? Vessels and nerves. Vessels and nerves. Consisting of vessels and nerves. This is the part which you see in the medulla. Now let us look at what are the peritoneal relations of your ovary. Peritoneal relations of this particular ovary over here. What are the peritoneal relations? So to understand the peritoneal relations, just look here. This is your uterus over here, and you know that here you have got your fallopian tubes with infundibulum, right, with the fimbriated process over here, and here you have got your ovary. This is your ovary. Now there is a fold of peritoneum that is attaching all the way to the ovary like this. You see, fold of peritoneum that is attached to the ovary like this. Now what is this fold of peritoneum attached to the ovary? This is called as a ligament of the ovary or ovarian ligament. Previously I told, if you remember, right? So what is this called? This is called ovarian ligament. So this ovary, what is this ovarian ligament? It is a fibromuscular cord that connects, right, that extends between the ovary to the uterus. So it is connecting the ovary to the uterus. What is this? It is a fibromuscular cord. Now from the ovary to the pelvic wall, previously I think I told the posterior abdominal wall, I'm sorry. So this is the pelvic wall, okay? So from the ovary all the way to the pelvic wall, whatever is attached over here, this is suspending the ovary. So you call it as a suspensory ligament of ovary, not uterus, suspensory ligament of ovary. So it is attaching ovary to your pelvic wall, So these are the two important things which you need to know. Now within this suspensory, you see, within this particular suspensory ligament of the ovary, there is an artery. Okay, so what is an artery? I told you this artery is a direct branch of abdominal aorta. Then what this artery will be? Ovarian artery. You see, this is an artery that is coming like this, right, and supplying to the ovary. What is this artery? This artery is your ovarian artery, which is present where? Within the suspensory ligament of your ovary. Okay, and remember there is an other artery also here. We have got, what is this artery? This is your uterine artery. Sir, you already told this ovarian and uterine artery in case of uterus. Yes, the same arteries are also supplying to your ovary. Uterine artery gives branches here, supplies to your uterus, supplies to your vagina also, and it is also giving branches that supply to your ovary also. Okay, so what are the two arteries that are supplying to the ovary? One is called as the uterine artery, another is called as the ovarian artery and the uterine artery. Okay, if you look at this picture, you will understand. You see, what is this ligament? Suspensory ligament. This is your suspensory ligament of ovary. And what is this particular ligament here? This is called as the ligament of ovary. So within the suspensory ligament, what is the artery here? Ovarian artery, which is a direct branch of your abdominal aorta. Direct branch of your abdominal aorta. Now let us look at the veins over here. Very easy. This is your right kidney over here and this is your left kidney over here. This is your right, this is your left kidney. Let us say there is a vein in the center, the major vein here. This is called as your inferior vena cava. And there is a vein that is entering here. This is called as your right renal vein. Okay, this is your right renal vein. And there is also another vein over here, which is very long here. This is called as your left renal vein. Remember, the left renal vein is longer in comparison with the right renal vein. Right renal vein, left renal vein. Okay, let us say here we have got two ovaries. This is one ovary, this is another ovary. The right ovary, the left ovary. From the right ovary, there is a plexus that is formed. This plexus is called as pampiniform plexus. What is this? Pampiniform plexus. Now this pampiniform plexus will give out a vein over here. This vein over here is called as right ovarian vein. What is this? Right ovarian vein. And this right ovarian vein, where do you think it will drain? It will drain directly into your inferior vena cava. Okay, it would drain directly into your inferior vena cava. But what about the left side? Left side also you have got pampiniform plexus, which will drain into your left ovarian vein. But this left ovarian vein is directly draining into what? It is draining into your left renal vein. Left renal vein. So this is left ovarian vein. Remember these. These are very, very, very important things. Okay, very, very important things. So these are the important things which you need to understand over here. Hello guys, so now we shall be discussing regarding the extravasation of the urine. Okay, the topic of discussion would be regarding the extravasation of urine. So all of you know, right, you have already studied regarding this extravasation of urine, and this would be a quick rapid review session on this. So regarding this extravasation of urine, you know that the urine normally flows from the urinary bladder right into the urethra, and then through the external urinary urethral orifice it exits out. For example, if there is any damage, let us say this is your urinary bladder and this is your urethra like this, right? So urine normally from the urinary bladder flows through the urethra in this way. For example, anywhere if there is a damage, anywhere if there is a cut or damage, then what is going to happen? What is going to happen is that the urine will extravasate. It will go into the other structures like some pouches, some cavities and all. So this concept which we will be discussing right now is extravasation of urine. So for this we have to draw from the lateral side. Okay, so the lateral picture of the lower abdominal region, the penis, the anal canal, the testis and all. So if we draw the lower part, right, then it would be easy for us to discuss, to look where the urine is going. Okay, so first of all, let me draw this particular part. You see, this is your anterior abdominal wall like this. Okay, down over here you have got the penis. Down over here you have got the penis, and right away here you have got your scrotum. So this is your scrotal sac, and next here this is your perineum like this, and this is your anal canal, and this is your buttocks. Okay, this is your buttocks on the back. Now if you look at the anterior abdominal wall, if you look at the anterior, okay, let me also draw the urethra over here so that it would be easy. So this is your urinary bladder, this is your urinary bladder, and you know that this is your urethra. This is your urethra all the way, and all of you know that right away here, okay, let me enlarge this picture over here. Yeah, all of you know that right away here you have got the prostate gland. So this part of the urethra which is located within the prostate gland, it means this part of the urethra which is located within the prostate gland is called as a prostatic urethra. Okay, so what is this called? This is called as your prostatic urethra. So let me draw this a little bit up so that it would be easy for us to discuss the remaining structures as well. So this part of the urethra over here, this part of the urethra over here is called as a prostatic urethra. Okay, now after that let me first draw the pubic bone over here, right? So let us say anteriorly you have got the cut section of the pubic bone like this. Clear? Anteriorly you have got the pubic bone. Now there is a very important structure which you need to understand over here. This is your urogenital diaphragm. So how do I draw this urogenital diaphragm? Let us say, see, this is your urogenital diaphragm like this. This is your urogenital diaphragm. Now, what do you mean by urogenital diaphragm is that all of you keep in mind that this particular urogenital diaphragm is having two important layers. Okay, so what are these two important layers? See, there is a fascia on the top like this. You see, there is a fascia on the top. So this fascia on the top is called as superficial fascia or superior fascia. Okay, and there is a fascia on the bottom also. So this fascia which is located in the bottom is called as inferior fascia. Okay, there is something called as superior fascia, there is something called as inferior fascia. Now this is superior fascia and this is the inferior fascia. Inferior fascia is also called as perineal membrane. So what we will do is that we will put a point A over here, we will put a point A, we will put a point B. Okay, so what is A? What is A and what is B? A is nothing but your superior fascia. B is nothing but your inferior fascia, inferior fascia or perineal membrane, inferior fascia or perineal membrane over here. Okay, now at the end where these two fascia are meeting, exactly this point, you have got a body over here. This is called as your perineal body. Okay, so what is this particular body over here? This particular body over here is called as perineal body. This is called as perineal body, which is a fibromuscular structure I told you between two triangles. You remember that? Right. So these are the two important fascia over here. And next important thing is that there are two important muscles. See, here there is one muscle over here. Here there is another muscle. There are two important muscles. Let us say 1 and 2. Okay, so what are the two important muscles over here? Muscle 1 and muscle 2. What are these two important muscles over here? One is called as sphincter urethra. See, anteriorly we have got one, posteriorly on the back we have got two. So anteriorly we have got a muscle and that is called as sphincter urethra. Sphincter urethra anteriorly. Posteriorly, what do we have? Posteriorly, we have got a muscle and that muscle is called as a deep transverse perineum muscle. Deep transverse perineum muscle that is located posteriorly. So overall, what are the things we discussed, guys? Superior fascia or superficial fascia, inferior fascia or perineal membrane, sphincter urethra and deep transverse perineum. So all these structures which I told you together, you call it as urogenital diaphragm. Urogenital diaphragm. So it means this entire part, the violet whatever I have drawn is the urogenital diaphragm over here. Okay. Now there is a part of urethra which is, these are your prostate glands. So this part of the urethra, okay, this part of the urethra which is present in between the prostate glands, this is called as a prostatic urethra. Next, this part of the urethra which is present within what is this? Within your urogenital diaphragm, this is called as membranous urethra. Okay, and this part of urethra whatever is there here just beneath the membranous urethra, this is called as what? This is called as a bulbous urethra. What is this? Bulbous urethra. And next, this part of the urethra over here is called as penile urethra. Prostatic, membranous, bulbous, penile, correct. penile urethra over here. So how many different types of urethra we have got over here? See, this is, let us say, 1, this is 2, this is 3, and this is 4. So what are the 4 different types of urethra? In the urethra we have got 4 different types, right? So 1, 2, 3 and 4. What are these 4 different types? One is called as the prostatic urethra. Second one is called as the membranous urethra. Third one over here is called as the bulbous urethra. And remember one thing, most commonly the injuries of the urethra will happen near the bulbous urethra. Okay, bulbous urethra. And finally we have got the penile urethra. These are the structures over here. And next important thing is that, as I just now told you, that the outer layer is your superior layer, lower layer is your perineal layer, perineal membrane, right? So the space that is together, and here we have got muscles, I told you, right? Muscles, I told you. The space whatever is present in the center, right? This space is called as deep perineal pouch. What is this called as? This is called as deep perineal pouch. This is called as deep perineal pouch. Beneath the deep perineal pouch, whatever space is there, that is called superficial perineal pouch. It means, see, this particular area where area number 3 is there, right? This area is called as superficial perineal pouch. Remember that thing, superficial perineal pouch. Okay. Now, next important thing is that you know that this is your anterior abdominal wall, like this. Anterior abdominal wall. Now, anterior abdominal wall is having a muscle here. What is this muscle over here? This muscle over here is called as your anterior abdominal wall muscle. What is this muscle? This is your anterior abdominal wall muscle over here. These are the muscles of anterior abdomen, like external oblique, internal oblique, transverse abdominis. So these are the muscles over here. Okay, so these are the anterior abdominal wall muscles. Next, you have got fascia. Right, the superficial you have got skin. If I cut the skin, subcutaneous tissue, then you have got superficial fascia. These things we have discussed in the abdomen already. Superficial fascia is divided into 2. Okay, so I am writing it here first. What is the thing is that anterior abdominal wall, if you look at anterior abdominal wall, this anterior abdominal wall is having 2 important fascia. Anterior abdominal wall fascia, right, is nothing but your superficial fascia. This fascia is nothing but your superficial fascia. This particular superficial fascia is of 2 important types. I mean, there are 2 layers within the superficial fascia. What are those 2 layers? One layer is the superior layer, okay, or one layer is a superficial layer. Another layer is a deep layer. Okay, this is called as superficial fatty layer. This is called as deep membranous layer. So superficial fascia is in turn divided into 2 layers: superficial fatty layer, deep membranous layer. Superficial fatty layer is also called as camper fascia. It is also called as camper fascia. And deep membranous layer is also called as Scarpa's fascia. What is this? Scarpa's fascia. Okay, now just look at this important thing. So here let me draw this particular part. Yeah, see, this yellow color layer, whatever I'm drawing here, this is what? This is your superficial fatty layer. Okay, this is your superficial fatty layer, or you also can call it as what? This is called as your what kind of fascia you call it as? This is called as your camper fascia. Okay, this is called as your camper fascia. So this camper fascia is all along here. This is a superficial fatty layer. So we have got the camper fascia over here. This is your camper's fascia. Next important thing is that I have told you that there is another layer over here. What is that? Deep membranous layer, right? So this is a deep membranous layer. This deep membranous layer is nothing but called as what? This is also called as your Scarpa's fascia. Now, if you closely observe this deep membranous layer, once it enters into the penis, this deep membranous layer, once it enters into the penis, this is converted as penile sheath. What is this converted as? Penile sheath. So once it enters into the penis, it is converted as penile sheath. You see, this is a penile sheath over here. Okay, and this penile sheath continues down into your scrotum all the way, continues down into the scrotum all the way, and remember one thing, this penile sheath will later on convert into this very thick fascia over here. This fascia is called as Colles fascia. Okay, so what is happening with the penile sheath? The penile sheath is converting into Colles fascia, and remember, this Colles fascia goes and attaches to your perineal body. Okay, so what is this fascia over here? This is your Colles fascia. Colles fascia. Okay, and here we have got the outer fatty layer, that is your which layer? Outer fatty layer is also called as your Scarpa's fascia, right? Next, inner membranous layer. The membranous layer is also called as outer fatty layer is called as your Camper fascia. Camper fascia, and inner one is called as your Scarpa's fascia. Scarpa's fascia, right? So guys, if you remember that I have talked in the abdomen, right? If you remember that I have talked these things in the abdomen over here. So this is a thing that this particular Camper fascia, whatever is there, right? So let us discuss about Scarpa's fascia. This Scarpa's fascia continues as Colles fascia, right? Scarpa's fascia will continue as Colles fascia. Look at this Camper fascia over here. So this Camper fascia continues down into the scrotum as a very important fascia. So I am drawing it with the red. So this Camper fascia, whatever is there, it continues into the scrotum as a muscle over here. This is called as dartus muscle. What is this? This muscle is called as dartus muscle over here. Okay. So what you need to know over here, that the Camper fascia continues as dartus muscle, and the Scarpa's fascia continues as Colles fascia. Okay, it continues as dartus, and here it continues as your Colles fascia over here, right? So then finally this Colles fascia attaches to your deep perineal body. Now what is going to happen over? So what is the important thing? Now you understood where is your superficial and deep perineal pouch. See, this space whatever you see over here, this is called as your deep perineal pouch, and this region over here is called as your superficial perineal pouch. Okay, so these are some of the two important things you need to know. Now let us say there is urine all over in the urinary bladder, right? So there is urine all over in the urinary bladder. Now let us see what are the different kinds of injury we can basically have over here. Okay, for example, let us say that patient is having injury to the prostatic part. Okay, patient is having injury to the prostatic part over here. For example, if there is a cut over here, you see, cut to the prostatic part of the urethra here. Okay, when there is a cut over here, tell me where will the urine flow? And by the way, remember that you have got your abdominal layer, right? So between the urinary bladder and here you have got a pouch, and this is a peritoneum that is covering your abdomen like this. This is a peritoneum that is covering your abdomen. Okay, let me. Yeah. So this is a peritoneal layer which is covering your abdomen. Now if there is a cut over here, don't you think all the urine will flow over here? This urine is flowing behind the pubic bone. Yes or no? So the space whatever is there, see, this is a space that is present behind the pubic bone. The space behind the pubic bone is called as space of Reed's. Okay, that is called as a Reed's space or retropubic space. So what is going to happen is that if there is prostatic injury, the urine will flow into the space of Reed's or retropubic space, and not only that, the urine also will flow up all the way here. But will the urine enter into the peritoneal cavity? Will the urine enter here like this? No, the urine is not going to enter into the peritoneal cavity. Rather, the urine is going to stay between the peritoneum as well as the abdominal muscles, anterior abdominal muscles, right? So let us say scenario number 1. For example, if there is injury near the prostatic level, that is your prostatic urethra injury. If there is prostatic urethra injury, what is going to happen if there is prostatic urethra injury? Then the urine is going to flow all the way to the retropubic space. retropubic space, or also called as space of reeds. Okay, not only that, from there the urine will enter into your layers, right, between anterior abdominal wall muscle and peritoneum. Anterior abdominal muscle wall as well as a peritoneum. So that is where it is going to enter. So point number B. What is point number B over here? For example, let us say if patient is having injury at the level of B, okay, it means this point. See, number 2. For example, if patient is having injury here, what is this part of the urethra called as? Point number 2. This is your membranous urethra. If there is injury over here, tell me where will the urine escape into? Yes, the urine is going to escape into your deep perineal pouch. Okay, it will escape into a deep perineal pouch. There are also chances that the urine will also, see, if there is damage to layer A. What is layer A? Superficial fascia, right? So if there is superficial fascia rupture, see, if only the membranous part of the urethra is torn away, if there is only damage to the membranous part of the urethra and the superficial fascia, the superior fascia and the perineal membrane, both of them are intact, then what is going to happen? Urine will stay, right? Urine will stay within your deep perineal pouch. For example, if there is damage, if there is rupture of this particular membranous urethra along with this layer, what is this layer? Layer A is called as a superior layer. If membranous part of the urethra is ruptured and layer A is also ruptured, then tell me urine will tend to go up or go down? It will tend to go up, right? So this urine starts leaking into the perivesical space. Perivesical space in the sense the space around the bladder, space around the prostate gland. So it means here perivesical space over here around the bladder as well as the prostate. So this is situation number 2. Situation number 3 is that there can be rupture of membranous part of urethra along with the lower fascia. Lower fascia is your perineal fascia. Then what is going to happen? Then the urine will enter into this particular pouch over here. This pouch is called as your superficial perineal pouch. Clear? The urine will enter into the superficial perineal pouch. Okay. So what is the second type of injury? For example, if there is an injury all the way to the membranous urethra, membranous urethral injury, then what is going to happen? What is going to happen is that the the urine, whatever is there, it stays within the deep perineal pouch. It stays within the deep perineal pouch. Okay, it stays within your deep perineal pouch. It stays within your deep perineal pouch. Okay, for example, if membranous part of the urethra injury is there, along with that, if there is injury of superior fascia, then the urine tends to go up. Go up in the sense it will go to your perivesical space. Perivesical space in the sense the space around the prostate and space around the urinary bladder, around the prostate and urinary bladder. For example, if there is membranous part of the urethra rupture along with damage to the perineal fascia or perineal membrane, which means the membrane that is located down, right? Then what will happen? The urine can enter into the superficial perineal pouch. Superficial perineal pouch. Okay. Next important thing, that is the most common injury. Most common injury will occur at this part. This is called as a bulbous part of the urethra. So if there is injury to the bulbous part of the urethra, now you tell me where will the urine pass? So this urine can enter into your superficial perineal pouch. From there the urine can enter into your scrotal sac. Right? From there the urine can also enter here. You see? Urine can enter all the way down into the penis, right? But not into the urethra, on the sides of the penis, right? Can urine cross this pubic bone and enter up? No. What will happen is that it cannot go retropubically. Rather, the urine will pass like this. You see, now urine is passing between, what is this? Carpus fascia and the anterior abdominal wall muscle. Okay. So these are the places how the urine can pass. Okay. For example, if there is damage to what? damage to the third layer. What is that third layer called as? I mean the bulbous urethra. Damage to the bulbous urethra. If there is a damage to the bulbous urethra, where can urine pass? Okay. So if there is a damage to bulbous urethra, first urine can enter into your superficial perineal pouch. Yes or no? It can enter into superficial perineal pouch. Superficial perineal pouch. Next, it can even enter into your scrotal sac. Enter into your scrotal sac. It can even enter into your penis, the tissue of the penis, and it can even enter the layers between. What is the layer? The membranous layer. What is the membranous layer? Inner membranous layer is called scarpa's fascia, right? It can enter between the membranous layer and anterior abdominal wall muscle. Now tell me, if there is a damage to this area, can the urine enter into this particular space? What is this particular space? First of all, called as, see, this is your anal canal. Right? Now this is your anal canal. Now previously I have discussed that the space that is present around the anal canal here, is called as isio-rectal fossa. Right? Now tell me, can the urine enter into the ischiorrectal fossa? No. Why? Because of this Colles fascia and all, it cannot enter into the ischiorrectal fossa. So write it down that it cannot enter into ischiorrectal or isio-anal fossa. Okay. So these are some of the important things which you need to know regarding the extravasation of the urine. Now guys, we shall discuss what are the structures that support the pelvic viscera. Okay, what are the structures that support the pelvic viscera? So what do you mean? What are pelvic viscera? For example, urinary bladder, uterus, and rectum. You know, in the front we have got urinary bladder, in the center we have got uterus, back we have got the rectum. For example, I'm just drawing a rough picture here. This is your urinary bladder. Let us say this is your urinary bladder like this. Okay, this is your urinary bladder and this is your urethra. And let us also say that this is a vagina over here, cervix and your uterus like this. Okay, and posteriorly you have got your rectum. So you know that this is urinary bladder, this is uterus and this is rectum. Now all these structures, where are they located? These structures, see, they are located like this. Okay, this is the back buttocks. Okay, now, okay. Right, this is the back buttocks and this is the anterior abdominal wall in the front. Okay, so this is, let us say, this is a female patient like this. Okay. Now all these organs, there are a chance that all these organs can prolapse down, they can fall down. So what you need to do is that to prevent the prolapse in the sense the falling down of the organs. Okay, to prevent the prolapse, what you need to do is that from the front, from the back, right, from the sides also, from the front side, from the back side, from the side, from other side also like this, from opposite side also, from all these sides, what you need to do is that you need to give a support at the base. For example, let us say that this is a teacup over here. This is a teacup. Okay, and let us say this is some kind of charger like this, right? Let us say this is some other thing. Now all these structures are located here. Now what can happen? These structures can hang down. So to prevent this hanging, what am I doing? From my right hand side, from my left hand side down, and from the front and from the back, I am supporting all these structures like this. You see, all these are the supporting structures. So what are these structures which are supporting these pelvic viscera? We will discuss now. Okay, what are the structures that are supporting the pelvic viscera? We will discuss. So these structures might include some muscles. They will also include some folds, peritoneal folds, or let us say they might also include some let us say the when the muscle will end up with a fascia, right? So even covering the muscle, you will have the fascia, right? So even some of the places, these fascia will undergo condensation, and they will also form the support system for this pelvis. So what are the different things over here? So what are the structures that are supporting the pelvis over here is that first we will discuss about the fascia and its condensation, facial condensations. Actually fascia is like a thin membrane, right? It is like a very thin membrane. What you do is that if you see, if you take a paper, for example, if you take a paper or a cloth, let us say, okay, see, let us say this is a cloth, this is a cloth which you have taken. Now this cloth is very thin, yes or no? This cloth is very thin. Now for example, if I am condensing this cloth like this, if I am completely condensing this cloth like this, don't you think it is thick now, thick and stiff, yes or no? And this is strong enough to tear. So this is thick and stiff now. So these are called as facial condensations. What are these called? Facial condensations. So we will discuss what are the facial condensations which are supporting this pelvic viscera. Next we shall discuss what are the muscles that are supporting your pelvic viscera, and thirdly we will discuss what are the peritoneal folds. Peritoneal folds also we will discuss. Okay, so first of all we will discuss about the facial condensations. So to discuss about the facial condensations, how you have to look at the picture, guys? Tell me, if you wanted to study what are the structures that are in the floor, what are the structures that are from the right side, from the left, from the front, from the back, all these structures collectively are supporting the pelvic floor. If you wanted to look at them, either you look from the top, removing all the organs, or you look from the bottom. So from the bottom, if you draw the picture, how does it look from the bottom, right? You spread your legs, look from the bottom. So how does a picture look over here? Posteriorly, we have got the sacrum. Okay, so posteriorly we have got what? We have got the sacrum like this. These two structures are the ala of the sacrum. Okay, so posteriorly we have got the sacrum in this way. We have got the sacrum like this posteriorly. Okay, and anteriorly what do we have? Anteriorly here we have got a pubic symphysis. Okay, this is your pubic bones, and in the center you have got a pubic symphysis. Okay, so let us connect all these structures over here like this. So this entire structure over here forms the floor, down the floor. Okay, now posteriorly what do you have? Yeah, tell me, posteriorly what do you have? You have got rectum, yes or no? So let us say this is the rectum that is located posteriorly. So this is your rectum. Okay, anteriorly what do you have? You have got the urinary bladder. What is this? This is your urinary bladder located anteriorly. In the middle what do you have? In the middle you have got your cervix. What is this? This is your cervix. This is your cervix that is located in the middle. Now I want to protect all these organs. I want to give a support system to all these organs over here. How will I give? For example, let us say there is a ligament. See, this is a vagina and the cervix. On the top you have got, what do you have got? You have got uterus. Now if you are looking at the cervix, behind the cervix what do you have? You have got uterus. So from that uterus, now this picture looks as if I am drawing this particular shade from the cervix. No, I am drawing it from the uterus which is located behind or above the cervix. Okay, so from the cervix to the sacrum, from the cervix to the sacrum on both the sides like this. From the cervix to the sacrum on both the sides. Okay, from the cervix to the sacrum on both the sides. You see, you have got a ligament over here. This is called as utero, not from the cervix, I am really sorry, from the uterus. Okay, from the uterus. Okay, so if this is your cervix, right? This is your cervix and vagina. This is your uterus. This is your uterus. Now if you are looking from the bottom, you can only see at the cervix. Now what I am doing is that I am actually, if see here I have got sacrum, here I have got what? Sacrum. Now what am I doing actually is that from the uterus here, I am connecting a ligament from the uterus all the way to the sacrum like this. Clear all of you? Right, down here is the sacrum, from the uterus to the sacrum. If I am looking from bottom, it is looking that it looks as if the ligament is coming all the way from the cervix, but no, it is coming from the uterus. Okay, so this is called as uterosacral ligament. What is this ligament over here? This is called as uterosacral ligament over here. Next important ligament is that we have got a ligament like this. Okay, from the cervix it is coming now. Okay, from the cervix to the lateral side, lateral pelvic wall. Okay, from the cervix to the lateral sides of the pelvic wall, this ligament, whatever is coming over here, is called as what? Lateral or transverse. These are transverse cervical ligament. What are these? These are actually the condensation of your fascia. Okay, condensation of your fascia. Next important thing is, these are your pubic bones. From the pubic bone all the way to the cervix, you see, from the pubic bone all the way to the cervix, in this way, from the pubic bone all the way to the cervix. So from the pubic bone to the cervix, what is this? This is called as pubocervical ligament. This is called as pubocervical ligament. So we have got, one is called as the uterosacral ligament, transverse cervical ligament, and pubocervical ligament over here. Pubocervical ligament over here. Uterosacral, transverse cervical, as well as your pubosacral. Okay, so let me write down these three things. So what are the facial condensations over here? One is called as a transverse. One is called as a transverse cervical ligament. Okay, one is called as a transverse cervical ligament. You call it as a transverse cervical ligament of Meckenrod. Okay, what do you call it as? Transverse cervical ligament of Meckenrod. Okay, next, the second important thing after transverse cervical ligament is pubocervical ligament. Cervical ligament. After that, you have got the what is that? You have got the uterosacral ligament. So these are the three facial condensations that form the support system to your pelvic viscera. Now what we will do? We will discuss the second important thing, that is muscles. Okay, so what are the muscles that form the structures here? What are the muscles that form the structures over here? So there are three important muscles. Over here. So what are these three important muscles? These muscles you have already studied. Now look at this particular picture, you will understand these things. Okay, now see here, what is there? Look here. Here we have got urinary bladder. Okay, here we have got anal canal on the back. Let us say in between you will have ureter and all, uterus and all. This is a male, so I did not draw. So let us say in the center over here you will have the uterus and all. Now see, if I am putting something here, this line will be the support system, so that the organs on the top will not fall below. Yes or no? So first important thing what I am doing is that I am creating a line. This line, whatever is there, is a pelvic diaphragm. What is this? Pelvic diaphragm. I think this would be much more easier if you look at this particular picture. This particular picture over here, right? So in this particular picture, you see this particular diaphragm over here. What is this diaphragm? This is called as your urogenital diaphragm. Okay, what is this? Urogenital diaphragm. So you basically have got two important diaphragms, if you remember. One is called as pelvic diaphragm, we discussed. Another one is called as your urogenital diaphragm. Okay, so pelvic diaphragm and urogenital diaphragm, both of them, they form the support system at the base. Okay, they form the support system at the base. Second important thing, the perineal body. The perineal body is also forming a support system. It is called as a fibromuscular structure. Okay, next, two more muscles are there. What are the two more muscles over here? One is your sphincter muscle, and another one over here is your, what is this? This is your deep transverse perineum muscle. Okay, so two diaphragms, right? So here we have got two diaphragms. One diaphragm is called as pelvic diaphragm, and another diaphragm which you already know, that is called as a urogenital diaphragm. In the pelvic diaphragm, you will have two muscles, right? Levator ani and coccygenes. We have discussed about pelvic diaphragm already, guys. In that, I have told you levator ani and coccygenes muscles. Levator ani, how many muscles are there? Three muscles. I have already shown you the pictures of that, right? So that forms your pelvic diaphragm. And urogenital diaphragm is this one. This is your urogenital diaphragm. Okay, urogenital diaphragm is having two important muscles. What are those two important muscles? Sphincter urethra muscle and deep transverse perineum muscle. And along with that, back posteriorly we have got perineal body. So all these structures, they are forming what? They are forming a line down here, the base here. This is called as the support system for the pelvic organs over here. So what are the three important muscles that form the support system over here? Yeah, what are the three important muscles? One is two diaphragms over here. One is pelvic diaphragm. Another one is your urogenital diaphragm. Pelvic diaphragm and urogenital diaphragm. When it comes to the pelvic diaphragm, we have got levator ani muscle. We have got coccygeus muscle, levator ani and coccygeus. Coming to the urogenital diaphragm, in the urogenital diaphragm we have got the sphincter urethra, right? And the next important thing we have got is the deep transverse perineum, as well as the sphincter urethra muscle. And next we have got what? We have got the perineal body. So these are the three structures, these are the three muscles over here that form the support system for the pelvic organs. Next, third important thing is your peritoneal folds. What are the peritoneal folds that are forming the support system over here? Now, when it comes to the peritoneal folds, you know that attached to the uterus, attached to the rectum, attached to the ovaries, everything there, attached to the bladder also, you have got some ligaments that are holding it up. We have discussed it. Like for example, you know about broad ligament? You know broad ligament attaches to the uterus. Clear? You also know about round ligament of the uterus. We have also discussed about the round ligament. And third and fourth important thing. What is third and fourth important thing? For example, look here. This is the layer of peritoneum that is covering the rectum like this. And this is a layer of peritoneum that is covering the uterus like this. And this is a layer of peritoneum that is covering the urinary bladder. Now, between the rectum and between the uterus, you see a pouch over here. Can I call this pouch as what is this? Rectovesical pouch. What is this pouch? Rectovesical pouch. In the same way, can you see a pouch between urinary bladder and uterus? This is called as uterovesical pouch. Okay, so there are two folds of perineum. They are also forming the support system. Okay, one is called as a rectovesical pouch, another one is called as the uterovesical pouch. So two more important things. One is called as a rectovesical fold of peritoneum. Another one is the what is this? Uterovesical fold of peritoneum, right? So what is this? Rectouterine pouch, right? Not rectovesical, between the rectum and uterus. So you call it as rectouterine pouch, right? So rectouterine fold of peritoneum. Another one is uterovesical fold of the peritoneum. Okay, so these are the three important things which you need to know. One is facial condensations, muscles and peritoneal folds that are forming the support system, right? These are the structures that form the support of your pelvic viscera. So now we shall be discussing regarding the urinary bladder. Now, regarding this urinary bladder, first of all, let us discuss what is the capacity. You know, urinary bladder is useful for storage of your urine. So basic capacity, what is the basic capacity of the urinary bladder in case of an adult male? Okay, so the urine can store how much amount of urine? Around 120 to 320 ml. Okay. Then what is the mean? What is the mean of this? Mean is around 220 ml. What is the mean capacity? 220 ml is the mean capacity, right? Now, normally whenever, see, normally even if there is a single drop of urine in the urinary bladder, will you have a urge to, will you have a desire to urinate? Will you have a desire to micturate? Yes, no. How much ml of urine has to be in the urinary bladder for us to get a sensation or for us to have that desire to micturate? Okay, now I have to go to the washroom. So how much ml is needed for that? So if the amount of urine is more than 220 ml, if the amount of urine in the urinary bladder is more than 220 ml, that is when you will have a desire to micturate. Desire to micturate. Okay. Now, most of you will hold your urine, yes or no? For example, if you are in a very important meeting, or let us say you are traveling in a bus, right, from an unknown area. So, it is very unsafe to get down there. So, in that case, you have to hold your urine. So, how much ml of urine you can hold it actually within your bladder is 500 ml. So, 500 ml of urine is tolerated. 500 ml of urine is tolerated, but if it goes beyond 800 ml, right, your urinary bladder, your sphincters, whatever are there, they are not under your voluntary control, so you will immediately urinate. They are not under voluntary control, they are not under your voluntary control, so immediately the patient will urinate. Okay. Next important thing over here is that there are two important things which you need to know. See, let us say, where is urinary bladder exactly located? So this will also cover up a little part of anatomy also. So let us say this is your pubic bone, okay, and here you have got, you are looking from the lateral view, okay, here you have got your urinary bladder like this, and not to forget that this is your, what is this? Urethra. This part is your urethra. Now in the urethra, you already know that this part of the urethra over here is called as which part of the urethra? This is called as your, yes, prostatic part of the urethra. Why? Because this is your prostate gland over here. Okay. Just beneath that, you have got a structure, a diaphragm over here. What is this diaphragm? Urogenital diaphragm. I told you, urogenital diaphragm is having two layers. Superficial fascia, the superior fascia, the inferior fascia are also called as perineal fascia, and you have got a body on the back here. This is called as pineal body, right? Pineal body, and two muscles here, deep perineum, transverse perineum, you remember that, right? And next important thing is that here you have got a duct that is opening into, you see a duct that is opening into this, right? So this part over here is called as your seminal vesicle, and as usually on the posterior side you have got your, what is this? This is your rectum on the posterior side. Okay. Now look here that I am going to draw the pouches. Let us say there is a pouch that is, I mean there is a layer of peritoneum that is covering your rectum, that is also covering your urinary bladder here. Okay. And it is going up like this. Okay. And what is this pouch over here? This pouch that is present between the rectum posteriorly and urinary bladder anteriorly, this is called as a rectovesical pouch. Rectovesical pouch. What is this? Rectovesical pouch. Okay. Now next important thing is that attached all the way from your pubic bone, attached all the way from your pubic bone to the prostate gland, you see a ligament over here. What is the name of this ligament? This is between the prostate and pubic. So prostatopubic, puboprostatic ligament. What is this? Puboprostatic ligament between the prostate and the pubis. This ligament is puboprostatic ligament. And what is this particular structure over here? This is called as your urogenital diaphragm. Okay. Now here can you see, and by the way, there is one more important structure you have to notice over here. right? So anteriorly you have got a ligament over here. This is called as median umbilical ligament. So this one is your anterior abdominal wall. This is your anterior abdominal wall over here. Okay. So now can you actually figure out a space that is located behind here? Can you look at a space that is located behind? You see, where is this space located, guys? Yes, where is this space located? This is located behind your pubic bone. So already I talked about this. The space located behind your pubic bone is a retropubic space. Okay, you call this as a retropubic space or space of retzius. So this is called as retropubic space of retzius, retropubic space of retzius. Okay, so this, where is your urinary bladder located now? Your urinary bladder is located behind the pubic bone, behind the pubis and in front of the rectum. Behind the pubis and in front of the rectum in case of males. It is located behind the pubis in front of the uterus in case of females. So where is your pubic bone located? Where is your urinary bladder located? The location of urinary bladder is, it is located behind the pubis, okay, and in front of the rectum, behind the pubis and in front of the rectum in case of males, okay, and behind the pubis and in front of uterus in case of females, okay. So this is the location of your urinary bladder over here. Now what we will do is that we will remove the urinary bladder. We will look from the left lateral view. Okay, what do you mean by left lateral view? Left lateral view in the sense, let us say, see, this is a urinary bladder, for example. Okay, it's not a urinary bladder, I know, but let us say this is a urinary bladder. This is the anterior view, this is a posterior view. Okay, so here we have got the anterior view, right? This is the anterior surface, this is the posterior surface. Okay, what is the lateral? These two are the laterals. So this view over here through which I am looking is called as a left lateral view. When I draw it, you will understand it anyway. So we are drawing right now the left lateral view of your urinary bladder. Okay, so right, so this is one border over here, and see, this is the left lateral view here, and from here also we have got it like this. So when I bit shade it, you will understand here. So this is the picture over here. This is a picture over here, right? So this view over here, whatever you can see, is your left lateral view. This is your left lateral view over here. This is your left lateral view over here. Now in this particular left lateral view, where is your ureter? See, this is your ureter over here. This is your ureter which is hanging down over here, right? And not to forget, so this surface, whatever I am drawing over here, right, which I am sketching over here, this is your superior surface. So this is on the top, the superior surface. And where are your ureters? Where are your ureters over here? See, this is your urethra, right? Where are your ureters over here? So here we have got one ureter like this. This is one ureter over here, and we have got another ureter here. So we have got two ureters over here. So this is one ureter and it's opening, and here we have got an other ureter and it's opening over here. Another ureter and it's opening over here. Okay, so ureteral orifices will be inside there. And next important thing is that here I have got a ligament like this. This is called as median umbilical ligament. What is this? Median umbilical ligament. I will tell about this in a minute. Okay, so this is your median umbilical ligament. I'll talk about this in a minute. Now what are the surfaces which you can see? See, this particular surface which you can see over here is the superior surface. What is this? Superior surface. Okay. Next important thing is that this particular surface which you can see over here is a posterior surface. What is this? Posterior surface. And what is this point over here? This is called as a apex. This is called as a apex. Okay. Next, we have got two important surfaces here. See, this is also this lateral surface. See, this is also lateral surface, right? So this lateral surface is down. So you call this as inferolateral surface. I hope you are able to relate it. Inferolateral surface, and this surface is also lateral surface but located on the posterior side. So posterolateral surface, and not to forget that here you have got, what is this? This is your prostate gland. Here you have got your prostate gland like this. Clear over here, right? So what are these two structures over here? These are your ureters. Over here. So what are the different surfaces which you have? The top one is a superior surface. Just below that will be your inferior surface. This is a posterior surface. This is the apex over here. So on this side, on the left side, this is called as inferolateral. On the other side also you will have inferolateral. Next, what is this? These are the lateral side. This is also a lateral side, right? But what lateral sides is that? Posterolateral. Okay, posterolateral side over here. So this is your structure of your urinary bladder from the left lateral view. Now, what is your medial umbilical ligament is that this medial umbilical ligament is an obliterated urachus. Now, what is urachus? Obliterated urachus. What is this urachus? Urachus is a part of your allantois. Normally during the embryonic development, from the urinary bladder to the umbilicus. Urinary bladder is down, umbilicus is somewhere here. From the urinary bladder to the umbilicus, there is a connection. This connection was called as urachus. Later on, what has happened? This urachus, whatever is there, this will condense and form a ligament called medial umbilical ligament. But in some patients, still what will happen is that this opening, whatever is there, this remains as an opening only like this. If it is remaining as an opening like this, even after the birth without obliteration, what will happen? Urine from the urinary bladder will enter into your umbilicus and urine will come out of your umbilicus. Okay, so that can happen to the patient over here. So that is why you need that it has to be obliterated. Okay, so next importance, yeah, that is the important thing. If not obliterated, what is going to happen? The urine drains from the bladder. Urine drains from the bladder all the way into your umbilicus. Okay, so this kind of attachment is called as urachal fistula. Okay, now you know this urachal fistula, whatever is there, this is a pre-malignant condition. It means it can in future convert into a cancer, and that is urachal adenocarcinoma. So this urachal adenocarcinoma is similar to the adenocarcinoma of the bowel. Okay, whatever it is, just remember this point. This is a very high yield point. I mean the extra edge point, that is urachal adenocarcinoma. If you want to remember it. Okay. Now let us see that what are the ligaments that are attached to this particular uterus. What are the different kinds of ligaments you see that are attached to the uterus? Sorry, the urinary bladder. So coming to the urinary bladder, we have got ligaments that are attached to the urinary bladder. What are the ligaments? There are two important ligaments. Some are called as true ligaments, some are called as false ligaments. Okay, what we will draw is that we will draw a picture from below and the same picture which we drew before, right? So now we will draw the picture from below and discuss the same important things. I mean, discuss what are the structures you have got, what are the ligaments you have got over here. So first goes with the pubic symphysis on both the sides. So this is a pubic symphysis here. This is a pubic symphysis over here. Pubic bones over here. In the center you have got what? This is your pubic symphysis, right? So on the back, on the posterior aspect here, you have got sacrum. Okay, so on the posterior aspect you have got the sacrum. You have got the sacrum over here. Posteriorly, you have got the sacrum over here. Now, here, what are the important structures you have got? See, this anteriorly you have got what? Urinary bladder. Anteriorly you have got, this is anterior end, this is a posterior end. Anteriorly you have got urinary bladder. Posteriorly you have got what? Posteriorly you have got the rectum like this. This is a rectum located posteriorly. In the center, what do you have got? In the center you have got the, what is this? You have got the uterus like this. Okay, so anteriorly you have got the urinary bladder, this is the uterus, this is the rectum over here. Okay, now look here, let us look at the ligaments. Now the ligament that is attached, and by the way, let me put this picture a bit down. Now by the way, here you have got umbilicus. Here you have got umbilicus like this. Okay. Now tell me, what is that ligament which is connecting? What is that ligament which is connecting urinary bladder all the way to the umbilicus? Yes, urinary bladder to umbilicus. We just discussed here. This ligament from the urinary bladder, it is going and attaching to the umbilicus. What is that? Median umbilical ligament. Right. So what is this ligament over here? This is your median, not medial, it is median umbilical ligament, median umbilical ligament over here. Next important ligament is that, see, here we have got a very important ligament like this. Okay, in the same way on the side also we have got a very important ligament here. Okay, so what are these ligaments? What are these ligaments over here? These two are attaching the pubic bone on one side to the urinary bladder on other side, right? Pubic bone on one side to the urinary bladder on other side. You call them as pubovesical. Pubic and vesical, vesical in the sense urinary bladder, okay? Pubovesical or puboprostatic ligaments, okay? So what do you call these two ligaments over here? These two ligaments over here are called as puboprostatic ligaments. Prostate gland you have got in the males. So in the males you call it as puboprostatic ligament, and in the females you call it as pubovesical ligament. Pubovesical ligament in the females. Okay. How many are there? 1, 2 on the lateral side, 2 on the medial side. So you have got lateral and you have got the medial. So you have got lateral puboprostatic, medial puboprostatic. Next important thing is that all the way attached from this particular urinary bladder, you have got some more ligaments that are attached transversely in this way. You see, there are some ligaments that are attached transversely in this way. What are these ligaments which are attached transversely? These are called as lateral ligaments. What are these called? Lateral ligaments. How many lateral ligaments we have got? We have got 2 lateral ligaments. Next, from here you see 2 more ligaments are going back in the sense anterior or posterior? Posteriorly. So what are these ligaments called? Posterior ligaments. What are these? Posterior ligaments. How many are there? 2 ligaments. Okay. Next, from the rectum also you see 2 ligaments going laterally like this, right? So what are these ligaments that are going laterally from the rectum over here? Lateral rectal ligament. Lateral rectal ligament. How many are there? There are 2 lateral rectal ligaments over here. So let us write down all these ligaments down. So the first ligament over here is your lateral ligaments. How many lateral ligaments are there? 2. Second one over here is puboprostatic ligament in case of males, right? So how many are there? Lateral we have got 2, lateral we have got 2, and medial we have got 2. Third important thing is median umbilical ligament. Okay, that is what 1. Fourth important thing is the posterior ligaments. We have got the posterior ligaments, they are 2. Posterior ligaments are 2. Next important thing, Coming to the next important thing over here, that is your false ligaments. I told you true ligaments and false, so these are all your true ligaments. Now coming to false ligaments, I cannot show you the picture over here, just remember the false ligaments, very easy. So one is median umbilical fold, median umbilical fold. So when I tell median, there is only one. Okay, now I am telling medial umbilical folds. Medial umbilical folds, they are two. Next, we have got lateral ligament here. Now I am writing false lateral ligaments. False lateral ligaments. How many are there? They are two. We have got posterior ligaments here. Now I am writing false posterior ligaments. False posterior ligaments. Again, they are two. So totally 7 in number. Okay, false ligaments are 7 in number. Now let us discuss about the microscopic structure. Okay. Now let us discuss about the microscopic structure. How many layers we have got? 3 layers. So we have got the innermost layer, we have got the middle layer, and we have got the outer layer. So 3 layers of the urinary bladder over here. So innermost layer is a mucous membrane. Innermost layer is nothing but your mucous membrane. Mucous membrane. If you look at the urinary bladder, this is a urinary bladder like this, right? Urinary bladder. Here you have got the prostate. You know, in the center of the urinary bladder there is a triangular structure. This triangular structure is made up of mucus. Okay, this is a mucosal membrane which is in the form of a triangular structure. So that mucosal membrane, you call it as trigone. You call it as trigone. Coming to the middle layer, most of the time it will be muscle only, right? So it is a muscular layer. Middle layer is a muscular layer, muscular coat. Middle layer is a muscular coat. So what does this middle layer consist of? It contains a muscle, and the name of the muscle is what? Detrusor muscle. Detrusor muscle. So what is in turn this middle layer or detrusor muscle is consisting of? It is consisting of 3 different types of fibers. There are outer fibers, there are middle fibers, there are inner fibers. We have got outer longitudinal layer, we have got middle circular layer, outer longitudinal, middle circular, inner longitudinal layer, So outer longitudinal, middle circular and inner longitudinal layer. Coming to the outermost layer, that is called made up of fibroelastic tissue. This is made of fibroelastic tissue. Fibroelastic tissue. Okay. So what are the layers over here, guys? Inner layer, outer layer is made up of fibroelastic tissue. Then we have got inner and middle layer. Middle layer is muscle, inner layer is mucous membrane, which forms the trigone. So now we shall be discussing regarding another important part over here, that let us look at what are the internal structures that are located within the urinary bladder. Okay, so what are the internal structures which we have within the urinary bladder? So if you look at the internal structures, first let us draw that this is your urinary bladder like this. This is your urinary bladder, right? Yeah. Now in this particular urinary bladder, you have got a very important structure. I told you the center part of this is called as trigone, right? So here you have got a triangular shaped area, right? That is the inner mucous layer over here, that is called as your trigone over here. Right, now this trigone comes down here, and there is a small swelling of this particular area. I will talk about these structures in urethra. Okay, so next down you have got your urethral orifice like this opening. Okay, and next important thing is that you should know that here we have got what? This is your prostate gland. So here we have got our prostate gland like this. So this part over here is called as your prostate gland. So this part over here is called as your prostate gland over here, right? Now a few important things you should know, that where is your ureter over here, where is your ureter? So this part over here is your ureter. Okay, so where is your ureter opening here? Your ureters are opening on the two posterior-superior borders, right? You see, in this particular picture over here, we discussed that this is a posterior surface. This is the top of the posterior surface. It means the posterior-superior border. So ureters here are opening on both the sides on posterior-superior border like this, right? Where is the ureter orifice over here? So this is the ureteral orifice. Both the ureters and their orifice is over here. So let me draw it in the dotted way over here. So this is your ureteral orifice. This is your ureteral orifice over here. Now you can see here that between these two important structures. So these are the internal structures over here. So let us name these internal structures. What are the internal structures we have got one by one? Okay, you know, these are called as your ureters. These are your ureters on both the sides. Okay, and what is this particular orifice of this ureter? This is called as ureteric orifice. Okay, what is this? Ureteric orifice. Okay, next important thing is that, see, here you have got ureteric orifice, here you have got ureteric orifice. Between the two, you see this line over here, this red color line. This is a ridge that is present between two ureteric orifices. So you call it as interureteric ridge. Okay, what do you call this as? You call this as interureteric ridge. You also call it as bar of Mercier. Okay, you also call it as bar of Mercier. Okay, you also call it as bar of Mercier. In the same way, you have, and by the way, what is this? This is your trigone. Not to forget that this part is your trigone. Now this interureteric ridge, whatever is there on both the sides, I mean on the right end and on the left end, what is happening is that this interureteric ridge have some small extensions like this. Okay, so for example, this is interureteric ridge, right? So on one side it is having some small extensions, on the other side also there are few small extensions like this. Okay, so these extensions, or you can also call these as the lateral ends of this interureteric ridge, right? It extends in the form of small ridges. Okay, these extensions or these folds, whatever are there, they are called as ureteric folds. These are called as ureteric folds. Actually these are the mucosal folds here. Okay, next important thing is that, you know, this opening whatever is there, see this particular opening whatever is there, this is called as internal orifice of the urethra. This is called internal orifice of urethra. Okay, on both the sides you have got a sphincter over here. See, here we have got sphincter. Now this sphincter is present inside, so you called as internal urethral sphincter. Internal urethral sphincter over here. Okay, next important thing is that exactly in the center there is a small, I mean you see this entire blue color part, whatever structures that are located here, you see in this entire part here, this is all the mucosa. So there is a small elevation of mucosa. This elevation of mucosa is what is called as uvula vesicae. What is this? Uvula vesicae. Where is this uvula vesicae located? Exactly above this internal orifice of your urethra. There you have got uvula vesicae. Now look here. Here this is the ureteric opening. Okay, ureteric opening. And at this level, this is the opening of the urethra, internal orifice of the urethra. So this particular ridge, you can see the lateral ridges whatever are there, this lateral ridge is present between the ureter on one side and urethra on the other side. So this ridge over here is called as urethral right? Urethral ridge. Now there is another name that is called as Bell's bar. Bell's bar. Bell's bar or urethral ridge over here. Okay, so these are some of the very important structures which you need to know over here. Now let us write down these structures for your notes purpose. Okay, so first, what is a structure that is present antero-inferiorly? Antero-inferior, this is your anterior side, this is your anterior surface picture. Inferiorly in the sense down over here. Okay, so what is a structure that is present antero-inferiorly? So antero-inferiorly, we have got internal orifice of urethra. Internal orifice of urethra. Next, what do we have posterior-superiorly? Posterior-superiorly, what structures we have got? So posterior in the sense this is a posterior border, superior, posterior-superiorly. Superior in the sense this is a superior border and these are the posterior border. So actually you cannot see posterior-superiorly here, right? So where you can see from the left lateral view you can see the posterior-superior border. So if you look over here, so this is the anterior and back side here this is the posterior. In the, see this entire part is a posterior. In this entire posterior part, this part is a postero-inferior, this part is a postero-superior and this part is a posterolateral. So postero-superiorly what do we have? We have got two ureters over here. Okay, so postero-superiorly we have to write down as two ureters. Postero-superiorly we have got two ureters here, ureters opening, ureteral opening over here. Okay, and next, what do you mean by uvula vesicae? What is that uvula vesicae? I just now told you that uvula vesicae is a slight elevation in mucous membrane. A slight elevation of the mucous membrane. Slight elevation of the mucous membrane is called as uvula vesicae. Okay, so this is some of the very important things which you need to know, the internal structures of the urinary bladder. Okay, so right now we have discussed about the internal structures of urinary bladder. Next important thing over here is that let us look at the blood supply. Now blood supply, remember I have mnemonic, remember by the mnemonic Lewis, L-O-U-V-I-S, Lewis. Okay, so what is the blood supply over here is that, see this is your abdominal aorta. This abdominal aorta is dividing into two common iliac arteries, right common iliac and left common iliac artery. The common iliac arteries are in turn divided into external iliac as well as your internal iliac artery, external and internal iliac artery. Now look at the branches of this internal iliac artery. This is your internal iliac artery, external iliac artery, common iliac artery. Now what are the branches of this internal iliac artery? See, the first branch which we have over here, okay, that is with the letter L. The second branch is O. Third branch is U. Next branch is V. Then after we have got I. After that we have got S. So what are these branches one by one? First, what does S stands for here? S stands for superior vesical artery. Superior vesical artery. I stands for inferior vesical artery. Inferior vesical artery over here. Okay, V, what does V stand for over here? V stands for vaginal artery. Vaginal artery. U stands for uterine artery over here. U stands for uterine artery. O stands for obturator artery. Obturator artery. And finally we have got L. Actually there is nothing by L over here. So L here is inferior vesical artery. So yeah, we have already written inferior vesical, we have written superior vesical, right? L, just convert it as I, okay, that is inferior gluteal artery. Okay, these are all the arteries that supply to your bladder. So guys, now we shall discuss about the innervation of this particular urinary bladder. There are both sympathetic and parasympathetic nerves. So let us draw this. Let us say this is your detrossus muscle. okay, and you know that here you have got the urethra like this, okay. Now important thing you need to understand over here is that we have got two important sphincters over here. What are those two important sphincters? So here I have got a sphincter which is very inside, right? This is called internal urethral sphincter. Next, near distally also we have got a sphincter called external urethral sphincter. How many sphincters we have got? Here we have got internal urethral sphincter. Here we have got external urethral sphincter, two sphincters, internal and external urethral sphincters, right? Now, as I told you, there are parasympathetic fibers and sympathetic fibers. Parasympathetic fibers, they start originating from S2, S3 and S4. So from S2, S3 and S4 segments, you see that the parasympathetic fibers are originating here. Okay. Now these parasympathetic fibers, they end up in a ganglion over here. Now from the ganglion, what is going to happen? There are postganglionic fibers. Some of the postganglionic fibers, they innervate your detrosous muscle. Some of them, they innervate your internal urethral sphincter. So what are they going to do? What are they going to do is that they are going to activate your detrosous muscle and they are going to relax your internal urethral sphincter. So parasympathetic system, see, when you are resting, that is the time you urinate. When you are running, you don't urinate, right? So when you are running, you catch and you urinate? No, you can't, right? So when you are resting, that is when the parasympathetic system starts and that is when you will urinate. Now if I wanted to urinate, what will I do? First I have to contract the bladder. I have to contract the bladder and down sphincters are there. I have to relax the sphincter so that the urethra is open. Now I am contracting the bladder and relaxing the sphincter at the same time. So that is where the urine will pass down, okay? Now when it comes to the opposite action is what? Sympathetic action. So the root values over here is from T11, T12, L1 and L2. From all these segments, you see the sympathetic nerves come here. These are the parasympathetic nerves and here I am drawing the sympathetic plexus, right? Sympathetic nerves over here. Now the sympathetic nerves come all the way from T11, T12, L1 and L2. Again, all the sympathetic nerves, they are going to end up in a ganglion again. Now from here, what is going to happen? The postganglionic fibers, they innervate your detrosous muscle, right? And they innervate your internal urethral sphincter. This time the opposite action will happen. So I have to, while running, I should not urinate. If I should not urinate, the bladder should not contract. So I have to inhibit the action of bladder. In the same way, I should contract these sphincters. I should activate the sphincters so that these sphincters will contract or constrict the urethra so urine will not pass out. So I have to activate this. So this is the sympathetic action over here. Okay. Guys, now we shall be discussing regarding the ureter. Sorry, we shall be discussing regarding the urethra. Okay. So what are the different parts of the urethra? We'll discuss. So this picture many times you have drawn. So tell me what are the structures over here. This is your urinary bladder. This is your prostate. You know that. Okay. Now we have got sphincters over here. As usually, you know these sphincters, right? So first of all, you see this sphincter over here. This is more inside. So you call it as internal urethral sphincter. Internal urethral sphincter. Internal urethral sphincter over here. Okay. In the same way, this sphincter over here is called as external urethral sphincter. External urethral sphincter. Okay. Next important thing is that let us indicate what are the different parts of urethra. Okay. So all of you just look here. This is the prostate gland. Okay. So this particular urethra which is located in the prostate gland is called prostatic urethra. Next here is that you see this part of the urethra. This part of the urethra, where is it located? It is located in this urogenital diaphragm over here. So this part of the urethra which is located here is called as a membranous urethra. Okay. After that, you see this part of the urethra, right? This part of the urethra immediately after, what is this? This is your superficial fascia, right? Or superficial layer, and this is your perineal membrane, right? So just beneath the perineal membrane, the part of the urethra which you have over here is called as what? So this part of the urethra over here is called as the bulb of the urethra. What is that? This is called as a bulbous part of the urethra, okay, or the bulb of the urethra. Next, This part of the urethra which is enclosed by the penis is called as a penile part of the urethra. Okay. So what are the different parts of the urethra we have got? This is called as a prostatic urethra. Okay. This part over here is called as a membranous urethra. Prostatic urethra, membranous urethra. This is called as the bulb of urethra. Bulb of the urethra. This is called as a penile urethra, penile part of the urethra. Penile part of the urethra. So distally also the urethra is little bit distended over here. This is called as navicular fossa. Navicular fossa. Okay. So these are the different urethras over here. Okay. So what are the different urethras, guys? We have got the prostatic urethra, we have got the membranous urethra, bulb of the urethra, and penile urethra. Okay. So most common injuries will happen to the bulb of the urethra. Okay. Most commonly we have got the injuries of the bulb of the urethra. Okay. So these are the different kinds of urethra which you have got over here. Okay. Now next important thing is that let us right now discuss about the prostatic urethra. Okay. So because in the prostatic urethra you see a swelling over here, this prostatic urethra is usually 3 centimeters long. Okay. How much is this? This is usually 3 centimeters long. So let us discuss about this prostatic urethra. So this swelling, whatever you see, actually what is this swelling, I'll tell you clearly. Picture is there, yeah. This part over here. Okay. So exactly if you see in the center of this prostatic part of the urethra, in the center of this prostatic part of the urethra, you see this particular median longitudinal ridge, right? You see in the center it is. So it is median, it is longitudinal, it is in the form of a ridge, right? So this is called as urethral crest. What is this urethral crest? Urethral crest is nothing but the median, not medial, it is median longitudinal ridge of mucous membrane. Medial longitudinal ridge of this mucous membrane. Next, as you are continuing down, there is a swelling, right? So what is this particular swelling here? What is this particular swelling here called as? This swelling is nothing but, see, this entirely you call it as a urethral crest. But in the center of the urethral crest, there is a swelling. This swelling you call it as colliculus seminalis. What is this? Colliculus seminalis. So what is this colliculus seminalis? It is just an elevation in the middle part of the urethral crest. So within this colliculus seminalis, you have got 3 important apertures. Okay. So what are these 3 important apertures? You see the center one over here. This center one is the opening of prostatic utricle. It is the opening of prostatic utricle. It is the opening of what? Prostatic utricle. On both the sides also there are openings. These openings are in a pair. These are called as the openings of ejaculatory duct. Openings of ejaculatory duct over here. Okay. Next, on both the sides of this crest, you see some open sinuses. You see some open cavity over here. Here also there is an open cavity. These 2 open cavities are nothing but called as sinuses. What are these sinuses over here? This is called as prostatic sinus. Prostatic sinus. How many we have got? On both the sides we have got 2 prostatic sinuses. Right? If you look close enough into the prostatic sinuses, into this prostatic sinuses there are some openings. There are some openings in this prostatic sinus. You know how many openings will be there? Around 15 to 20. These are the openings of prostatic glands. So these openings are the openings of prostatic glands. So how many openings are there? Around 15 to 20 openings are there. 15 to 20 openings are there over here. Okay. So these are some of the very important things which you need to know regarding the urethra. So now we shall be discussing regarding the anal canal. Okay. So before we discuss regarding the anal canal, first of all let us start with some of the basics. Okay. So I hope now you understood. Let me draw the pictures fastly. This is your urethra, and up over here you have got your urinary bladder. Down to the urinary bladder over here, you what do you have? You have got the prostate gland. So this is your prostate gland over here, right? And you know that here you have got a diaphragm over here, and this diaphragm is called as your urogenital diaphragm, right? So this particular diaphragm over here, you call it as urogenital diaphragm. So posterior to that, you have got a body called as perineal body. So these things I have already spoke long time before. In the previous things and all, in the previous hour, we have already spoke about this, right? So here we have got our urinary bladder, okay, and here this is our prostate. This is our prostate, and this is the urethra, and this is your urogenital diaphragm. Genital diaphragm. And what is this one over here? This is your perineal body. Perineal body over here. And over here you have got your rectum. Okay, so let us say this is your rectum over here. Now this particular rectum is showing some kind of some degree of flexion over here. What is that flexion? We will look at it right now. So this is your rectum. Now here you have got a muscle actually. So this muscle is completely winding, it is completely surrounding your rectum here. So this muscle which is completely surrounding your rectum, this is called as puborectalis. It is one of the muscle of your levator ani muscles. Out of the 3 levator ani muscles, one muscle was puborectalis, right? So this is your puborectalis muscle. And obviously there is nothing new here. Back you have got your sacral region and the coccyx. Okay, so another important thing is that from the coccyx to the anus also you have got a ligament. This is called as anococcygeal ligament. What is this? Anococcygeal ligament. So this part over here is called as your rectum. Okay, and this muscle over here is called as your puborectalis. Okay, and this ligament over here is called as coccygeal ligament. But remember one very important thing, that this particular muscle puborectalis, whatever is there, this puborectalis is causing flexion. You see, because of this puborectalis there is a flexion, there is a depression or flexion in the rectum, right? So this puborectalis, it causes flexure, right? What might be the angle over here? The angle might be around 80 to 90 degrees. So puborectalis is pulling the rectum forward. As a result, there is an 80 to 90 degree angle which is seen over here. So such kind of flexion you call it as perineal flexion. What do you call it as? You call it as perineal flexure. Such kind of flexure you call it as perineal flexure. So this is one of the very important thing you have to understand over here. Now this is your anus, this is your rectum over here. Now this part which you can see, this part of the rectum which is dilated is called as ampulla. Okay, the dilated part of the rectum is called ampulla. Now if I'm drawing a line over here, you see I'm drawing a line. Now this line is a junction between the rectum on the top and the anal canal bottom. So that is why this junction is called as anorectal junction. So this junction is called as anorectal junction. What is this junction? Anorectal junction. And this entire thing over here which I'm drawing right now, this is called as your anal canal, right? And this opening, whatever you can see near the anal canal, this is called as anal orifice. Anal orifice. Okay, so this is the thing which you see basically in case of males over here. This is the thing which you see in case of males. Now in case of females there won't be much differences, right? So let us say this is your urethra, right, and this is your, let us say, what is this? Urinary bladder. Now here you have got the vagina like this, right, and here you have got your, what is this? This is your uterus. Okay, next on the back, obviously on the back side you have got a structure over here. This particular structure over here is called as your rectum. Clear? This is your rectum. Between the rectum and the anus, this junction, whatever you see, this is called as anorectal junction. Again, here also you have got a muscle that is causing a flexion at 80 to 90 degrees. This particular muscle over here is called as your puborectalis muscle. And back here, actually I cannot draw the entire diaphragm here, so just I'm drawing the perineal body over here. Okay, perineal body over. This is the thing which you see in case of females. And by the way, you know, this is your anal canal. Anal canal. And what is this opening over here? This is your orifice, anal orifice over here. Okay, this is your anal orifice. Now, important things if you see, let us look at what are the anterior relations. What are the anterior relations of what? Anterior relations of anal canal. What are the anterior relations of anal canal? Okay, so anteriorly what structures we have got? Let us discuss in case of males. Okay, next we'll discuss in case of females. First, in case of males, anterior to anal canal. See, this is your anal canal, right? If that is your anal canal, anteriorly what do you have? See, anteriorly what do you have? You have got perineal body. Yes or no? Anteriorly you have got perineal body. Anteriorly you have got urogenital diaphragm, and anteriorly you have got, see, this part of the urethra is called membranous urethra. Just beneath the membranous urethra, this part of the urethra is called as bulbar urethra. So what are the four important structures? One, anterior to this anal canal, you have got perineal body, you have got the diaphragm, urogenital diaphragm, you have got the membranous urethra, you have got this part, this is called as your bulbar urethra. Posteriorly, what do you have? If this is the anal canal, posteriorly I have got a ligament here called as what? Anococcygeal ligament. And posteriorly I also have got this small tailbone called as coccyx. Okay, so let us write down the things now. Anteriorly and posteriorly, what do you have? Anteriorly you have got the perineal body. Anteriorly you have got perineal body. You have got urogenital diaphragm. You have got the membranous urethra. You have got the bulbar urethra. Perineal body, urogenital diaphragm, membranous urethra, and bulbar urethra. Next important thing is that posteriorly what do you have? Yes, what are the things that are located posteriorly? You have got the anococcygeal ligament. Okay, next you have got the coccyx. Anococcygeal ligament and coccyx are present. Next, in case of females, what are the anterior relations? What are the posterior relations which we have? Okay, just look at the picture. In case of females, right, if this is the anal canal, anteriorly what do you have? You have got the perineal body. You have also got this part of the vagina. This is called as the lower part of the vagina. Okay, so anteriorly what do you have? You have got the perineal body and the lower part of vagina. Posteriorly what do you have? Posteriorly you have got the same structures that you have in the males, that is your anococcygeal ligament as well as your coccyx. So it is completely same. Anococcygeal ligament and coccyx are same. Okay, what do you have laterally? Lateral to the anal region. Now tell me, I have already drawn a picture previously, long ago. Okay, let me put that picture over here if I have it. So this thing we have already talked, if you remember. Laterally we have got something. What is that? Where is a very important fossa I told you. See, if this is your anal region, laterally what do you have? You have got this ischiorrectal fossa or isio-anal fossa. What is that? Ischiorrectal or isio-anal fossa you have got laterally. Laterally you have got isio-anal or ischiorrectal fossa. These are the structures you have got laterally. Now what we will do is that we shall make a coronal section, and in the coronal section we shall look at all the important structures that are located over here. So in the coronal section, how does a picture look? See, this dilated part, whatever I am drawing now, this dilated part over here is called, of the rectum, is called ampulla. What is this dilated part called? Ampulla. and down here you have got this particular structure. This is what is called as your anal canal. This is what is called as your anal canal. So one very important thing I am telling you is that, see, when I am drawing this dotted line is representing the, what is this? This is a junction. Junction between what? Junction between, see, this is your rectum, right? And this entire canal all the way from here till here is called as anal canal. What is this? Anal canal, right? Now, anal canal. Now, important thing is that between the rectum and anal canal, this junction is called as anorectal junction. Okay. So, this junction over here is called anorectal junction. So, at the level of anorectal junction only, we have got a ring that is called as anorectal ring. Anorectal ring. On either sides, you have got a muscle. Okay, see, on either sides over here you have got a muscle, and again I'm telling you, I have been drawing this muscle multiple times. So this muscle represents three muscles here. This is your levator ani muscle. This is your levator ani muscle, which is having three components I told you, right? Now let us and by the way, this dilated part is called as ampulla. I told you, dilated part of the rectum is called ampulla. Now if you look below the anorectal junction, so right away from the point here, from the anorectal junction over here, from here till 15 mm, it means here, okay, for about 15 mm, this part is called as the upper part of the anal canal. What is this called? Upper part of the anal canal. Next, the next 15 mm whatever is there over here, this is called as a lower part of the anal canal. So we divided the anal canal into two parts, upper part and lower part. Okay, so this is called as the upper part of anal canal, and this is called as the lower part or the middle part of the anal canal. Lower part or the middle. Why are you calling it as middle? Because we also have got one more part over here, right? So the upper part or here lower part or middle part of the anal canal. Now upper part is completely having mucosa, right? So you also call it as mucosal part. And remember one thing, that this upper part is lined by an epithelium called as columnar epithelium. What is that? Columnar epithelium. Any kind of infection or any kind of injury to this area will not give that much pain. Okay, so mostly the injuries here will be painless, but when it comes to the lower part or the middle part, right, so it is having non-keratinized stratified epithelium. What is that? It is having non-keratinized stratified epithelium. Non-keratinized stratified epithelium. Okay, now this upper part of the mucosal part is having what? It is having sweat glands as well as sebaceous glands. Now the lower part of the middle part, whatever is there, here there are no sweat glands or sebaceous glands. No sweat glands or sebaceous glands. So sweat glands or sebaceous glands are absent. Okay, so what is the only thing you have here? You have got only the venous plexus. Okay, anyways, we will go into detailed now, then you will understand totally. First, let us discuss about the upper part or the mucosal part. Now this upper part or the mucosal part, if you look carefully guys, within this upper part of the mucosal part, there are around 6 to 10. Okay, I'm not drawing all 6 to 10, we don't have any space. Let us say there are around 6 to 10 longitudinal folds like this. Okay, or 6 to 10 vertical mucosal folds. So in this mucosal part, what do we have? We have got around 6 to 10 vertical mucosal folds. Okay, what are these vertical mucosal folds are called as? These are called as anal columns. These vertical mucosal folds are called as anal columns. So it means these vertical mucosal folds are like this. Look, so we have got vertical mucosal folds like this. These vertical mucosal folds are called as anal columns. If you look at the lower border of these vertical mucosal folds, the lower border is covered by a semilunar shaped valve over here. You see, the lower border is covered by a semi-lunar shaped valve. Okay. So, what are these semi-lunar shaped valves over here? These are called as anal valves. These are called as anal valves. Now, within the anal valves, you see this cavity here. Just above the anal valve, you see this cavity. This cavity is nothing but called as anal sinus. What is this? These are called as anal sinuses. Okay. So, they are located what? Above the anal valves. These are called as your anal sinuses. Now, if I make a cut section like this, this is how you will see. Let us say this is the fold, mucosal fold, and this is how the anal sinus looks. Okay, where is your anal sinus now? See, this is your anal sinus. Where is the anal valve now? See, this anal valve is over here. This is your anal valve. If you look just above the anal sinus, you actually can look that there are some glands that are opening into this anal sinus. You see? There are some glands that are opening into this anal sinus. These are called as anal glands. What glands are called? These are called as anal glands. Okay, these are called as anal glands. But the lower part, okay, you see this? These are called as your, here I cannot show you the anal glands and all. Okay, keep that thing in mind. But I can show you one thing, that here you have got anal valves like this. Anal valves. So here, for example, if I am drawing a line over here which is exactly passing parallel to this anal valves, so this line separates the upper part from the lower part or the middle part. This line separates the upper part from the middle part. And what are these lines over here called as? These lines over here are nothing but called as your pectinate line. What is this line? This line is called as pectinate line. So can I tell the upper part ranges all the way, extends all the way between the anorectal junction to the pectinate line. So pectinate line is also called as what? A dentate line. Dentate line over here. So can I tell pectinate line is the lower part of the mucosal part? If this entire thing is a mucosal part, the lower part of the mucosal part is nothing but your pectinate line or your dentate line. But remember one thing, these valves, anal valves, whatever are there, the other name for these anal valves is valves of Morgagni. What are these? Valves of Morgagni. These are called as valves of Morgagni. These are called as valves of Morgagni. Okay. Next important thing is that all the way from the pectinate line or the dentate line, here you have got a whitish line over here, a small thin white line. This is called as what? This is called as your white line of Hilton. What is this line over here called as? This is called as white line of Hilton. So what you can tell? You can tell that the upper part extends, upper mucosal part extends between anorectal junction and the pectinate line. Next, the lower part, whatever is there, the lower part extends between pectinate line and white line of Hilton. Clear? The pectinate line or the white line of Hilton. Now, if you concentrate mainly on the lower part, right, this lower part is mainly containing venous plexus. Okay, let me draw this. You see here there are some veins that are located. Okay, so it is containing venous plexus. Only it is containing venous plexus, nothing other than that. It is containing venous plexus. There are no sweat glands, there are no sebaceous glands, nothing. Only venous plexus is there, and that is the reason why it is looking pinkish or bluish. Pinkish or bluish, right? So that is the reason why usually you can relate. I'm not going much deeper. So it is pinkish or bluish, okay, because of the presence of the venous plexus. Now below this white line of Hilton, till this part over here, you see this opening over here, this opening is called as orifice. What is this? This is called as anal orifice. Anal orifice. Okay, so how much is this one? This is around 8 mm in length. This is around 8 mm in length. Okay, so what is this part over here? This is completely the anal orifice region, so which is completely 8 mm in length. Okay, so this entire, the third part, so can I also call this as a third part, right? So first part is what? This one, right? Where is the second part? The middle part is called as your second part. Now what is the third part? Third part is this one. Okay, from here you continue with the third part. You know, third part is almost the epithelium which is located here in the third part is almost equivalent to the epithelium of the skin. That is why you call this as the lower cutaneous part. Third part or lower cutaneous part. Why? The epithelium here is almost equivalent to the epithelium of the skin. That is, it is having keratinized. Previously it was non-keratinized. Now it is keratinized. Keratinized what? Keratinized stratified squamous epithelium. Keratinized stratified squamous epithelium, and this is the layer that is containing sweat glands and sebaceous glands. It contains sweat glands and sebaceous glands. Sweat glands as well as sebaceous glands. Okay, this is the layer that is containing both the sweat glands as well as your sebaceous glands over here. Okay, so how many parts of the anal canal we have got? 3 parts: upper mucosal part, the middle part, and the lower part. Okay, now you understood what is pectinate line, what is dentate line. I mean, both of them are same. What is white line of Hilton, right? So all these are some of the important things you should know. So this explains that the total length is, what is the total length here? Yeah, it is around 15, 15, 30. It is around 38 mm. So total anal canal. So total anal canal is around 38 mm in length. Okay, it is around 38 mm in length. Okay, now let us draw the same picture once again and let us discuss where are the sphincters that are arranged over here. Okay, so for example, this is your ampulla here. This is your ampulla. Okay, yeah, so here I'm drawing a line over here, and this is your ampulla. This is your ampulla over here. Now, what did I tell you? Here you have got columns. Okay, you see, these are the columns. The upper 15 mm, you have got the columns like this, right? And down over here, what do you have? You have got valves like this. What do you have here? You have got the valves. And by the way, the line which is present over here, this particular line is called as a dentate line or pectinate line. And here the line which you have is called as a white line of Hilton. White line of Hilton. So this is the first part, this is the second part, this is the third part. Okay, now if you look here, we already know that there is a muscle all the way here, right? Here also we have got a muscle all the way. So this particular muscle over here is called as levator ani muscle. Levator ani muscle. Next important thing is that here you have got another important structure all the way that is coming down. You see, yeah, what is this particular important muscle over here which is present on both the sides? This particular important muscle which you can see over here is called as your internal anal sphincter. What is this muscle? This is your internal anal sphincter. Internal anal sphincter. This is your internal anal sphincter. Remember one thing, this internal anal sphincter is a smooth muscle. So when I tell by smooth muscle, is it voluntary? No, it is involuntary. It is involuntary. Okay, next important thing is that there is another sphincter over here called as external anal sphincter. You know about this. External anal sphincter is having 3 parts: a deep part, a superficial part, and down we have got the subcutaneous part. You remember when I was discussing the ischiorrectal fossa, there I have told you 3 parts, right? So this is the deep part, this is the superficial part, and this is a subcutaneous part. So all these 3 parts together, you call it as external anal sphincter. external anal sphincter, and this particular external anal sphincter is voluntary or involuntary? It is voluntary. It is voluntary. Okay, so it means it will be smooth or skeletal. It is a skeletal muscle. It is voluntary and it is a skeletal muscle. Okay, now if you look at what is the blood supply over here. Okay, so just let us just look at the blood supply. Right, so here again I am separating these lines here. So you know these lines now. This is called as your pectinate line and this is called as an anorectal ring over here. Okay, now what is the artery over here? So there is an artery that is supplying to the mucosal part. So here we have got two arteries from the top, right, which are supplying. What is this part? This is your, what is this part that is supplying above the pectinate? What is this above the pectinate line, guys? Right, if this is above the pectinate line, you have got the mucosal part. Okay, so this is the mucosal part. Below the pectinate line, that is a lower part. So the middle part. So this upper part of the mucosal part is supplied by superior rectal artery. So when I tell superior rectal artery, then the lower part over here is supplied by your inferior rectal artery. We have discussed this already. Okay, next important thing is that again I am drawing these two lines. Right, now look here, coming to the lymphatics. So from the upper part, the lymphatics whatever are there, these lymphatics whatever are there from the upper part, they are drained into pre-aortic lymph nodes. They are drained into what? Pre-aortic lymph nodes. Then what about the lower part? From the lower part, the lymphatics are drained into superficial inguinal lymph nodes. Superficial inguinal lymph nodes. So that is the reason why, for example, if there is any kind of ulcer or any kind of infection, there is swelling of this superficial inguinal lymph nodes. There is swelling of this superficial inguinal lymph nodes. Okay. Now, in the same way, coming to the nerves which are innervating here, we will divide the nerves here again. There are nerves supplying to the upper part. There are nerves that are supplying to the lower part. Okay, so what are the nerves that are supplying to the upper part? The nerves that are supplying to the upper part are autonomic nerves. So these autonomic nerves, they are coming from where? They are coming from a plexus called as inferior hypogastric plexus. In the same way, the lower part whatever is there, this is innervated by inferior rectal nerve. I already told inferior rectal nerve is a branch of Pudendal. Previously we discussed a lot about this Pudendal nerve. Coming to the veins, coming to the venous drainage, again here also this is also very easy. We will divide the venous drainage again into upper part and the lower part. Okay, upper part as well as the lower part. So if you look at the upper part we have got the superior rectal vein, lower part is by the inferior rectal vein. So these are some of the important things you should know. Apart from that, there is a very important concept of hemorrhoids, right? So all of you know what are hemorrhoids. So there are two different types of hemorrhoids. One are called as internal hemorrhoids, right? One are called as internal hemorrhoids and the other one are called as external hemorrhoids. Okay, so what is your concept of internal or external hemorrhoids? Internal hemorrhoids in the sense, see these hemorrhoids which you can see over here, right, these are called as internal hemorrhoids. External hemorrhoids are outside here. Okay, and where are these internal hemorrhoids? Internal hemorrhoids are above the pectinate line. Look here, you know this is the pectinate line and you know above the pectinate line which part do we have, below the pectinate line also which part do we have. Above the pectinate line if there is a hemorrhoid developed, they are called internal hemorrhoids. Below the pectinate line if the hemorrhoids are developed, this is called as external hemorrhoids. Now out of these two hemorrhoids, which are very painful hemorrhoids, that is the external hemorrhoids are painful and internal hemorrhoids are painless. Keep this thing in mind. Okay, so these are some of the important topics which you need to know regarding the pelvis. So these covers most of the important topics of your pelvis for your exams. Thank you so much for watching my video. Goodbye.